The hour of 10 a.m. having arrived, the House will come to order. Members, please take your seats. Sergeants at arms, please close the doors of the House. Prayer today will be offered by our colleague, Representative Kenyatta. Immediately after prayer, we will recite the Pledge of Allegiance. Members and guests, please rise as able.
Let us pray. Dear Lord, we come before you today with a heart of gratitude for your unwavering faithfulness and your boundless love. I remember you said in Psalms 37 and 25, I have been young and now I am old. Yet I have not seen the righteous forsaken, nor his seed begging bread. Lord, you told us in your word and have proven it through your deeds that you will never leave us nor forsake us. And that is why we put our trust in you. In a season of uncertainty, we hold on to this truth knowing that your provision is always sufficient. Just as you have been faithful through the ages, we trust you to guide us, Lord, to protect us, to steady us in our work to serve all Pennsylvanians. Lord, your word makes plain in Proverbs 19 and 17 that whoever is kind to the poor lends to the Lord, and he will reward them for what they have done. Help us embody that ethos of service and selflessness. Let everything we do reflect your compassion and your generosity of spirit. And Lord, finally, as you said in Romans 12 and 5, so in Christ, though through many, form one body, and each member belongs to all the others. Grant us the wisdom and strength to promote unity and prosperity in this commonwealth. Let your love, God, break down the barriers that divide, so we may walk together in service. May the words of our mouth and the meditation of our hearts be acceptable in your sight, O Lord, our Redeemer. In your name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Sergeants at arms, please open the doors of the House. Members, please take your seats. Without objection, the approval of the Journal of Wednesday, July 10th, 2024 will be postponed until printed. Colleagues, if I can have your attention. This morning, seated to the left of the Speaker's rostrum, I'm delighted to have a legislative intern who just began at my district office in the Cobbs Creek section of West Philly. This morning, we are joined by Abby Foster, who's a summer intern. Abby was just at the Capitol not long ago with her school. Colleagues, please listen. We have one guest, and it's very nice if the guests can hear themselves being announced. Abby was just here a few weeks ago with her school, Greater Hope Christian Academy. Since then, she's graduated and is getting ready to go to Community College of Philadelphia. This summer, as the heat cools down, we'll be knocking a lot of doors in Cobbs Creek in Delaware County. Please welcome Abby Foster and my Legislative District Office Director, Hans Van Mol. Are there requests for leaves of absence? The chair recognizes the majority whip, who indicates there are none. The chair recognizes the minority whip, who indicates there are none. The chair is about to take the master roll call. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. 202 members having voted on the master roll call. A quorum is present. Chair recognizes the majority caucus chair, Representative Schlossberg, for a caucus announcement.
Thank you, Madam Speaker. Madam Speaker, there will be an immediate meeting of the House Rules Committee in the Majority Caucus Room. House Democrats will caucus at 10:30. We will be prepared to return to the floor at 11:30.
Chair thanks the gentleman. Chair recognizes Minority Caucus Chair, Representative Dunbar, for a caucus announcement.
Thank you, Madam Speaker. Republicans will also caucus at 10:30. Republicans will caucus at 10:30. Thank you, Madam Speaker.
Chair thanks the gentleman. Chair recognizes the gentleman, Representative Mullins from Lackawanna County, for a committee announcement.
Thank you, Madam Speaker. The Appropriations Committee will meet immediately following the Rules Committee in the Majority Caucus Room. The Appropriations Committee will be meeting immediately following the Rules Committee in the Majority Caucus Room. Thank you, Madam Speaker.
Chair thanks the gentleman. The House will stand in recess until 11:30 a.m. unless sooner recalled by the Speaker. The hour 2 p.m. having arrived, the House will come to order. Chair recognizes Representative Harris, Chair of the Committee on Appropriations, who reports the following bills. House Bill 1293, re-reported as committed. Will the House agree to report it's agreed to? House Bill 2092, re-reported as committed. Will the House agree to report it's agreed to? House Bill 2339, re-reported as committed. Will the House agree to report it is agreed to? House Bill 2344, re-reported as committed. Will the House agree to report it's agreed to? Senate Bill 24, re-reported as amended. Will the House agree to report it is agreed to? The chair recognizes Representative Bradford, Chair of the Committee on Rules, who reports the following bills. House Bill 1032, re-reported as committed. Will the House agree to report it's agreed to? House Bill 1993, re-reported as committed. Will the House agree to report it's agreed to? House Bill 2216, re-reported as committed. Will the House agree to report it is agreed to? Chair recognizes the gentleman from Lackawanna County for a committee announcement. Representative Mullins.
Thank you, Madam Speaker. The Appropriations Committee will meet immediately in the Majority Caucus Room. The Appropriations Committee will be meeting immediately in the Majority Caucus Room. Thank you, Madam Speaker.
Chair thanks the gentleman. House will stand in recess until 2:00 p.m. unless sooner recalled by the Speaker. The hour of 2:30 having arrived, the House will come to order. The chair is in receipt of actuarial notes from the Independent Fiscal Office regarding House Bill 2450, which the clerk will now read.
House Bill 2450, printers number 3401, as amended by Amendment A05385. House Bill 2450, printers number 3401, as amended by Amendment A05391.
Chair recognizes Representative Harris, Chair of the Committee on Appropriations, who reports the following bills. Senate Bill 700, re-reported as amended. While the House agreed, the report is agreed to. Senate Bill 1001, reported as amended. While the House agreed to the report, it is agreed to. Senate Bill 1150, re-reported as amended. While the House agreed, the report is agreed to. Senate Bill 1154, re-reported as amended. While the House agreed, the report, it is agreed to. The chair is in receipt of the extracts from the Journal of the Senate, which the clerk will now read.
Clerk of the Senate being introduced, returned bill from the House of Representatives, numbered and titled as follows. House Bill 1540. With the information the Senate has passed the same, with amendment in which the concurrence of the House of Representatives is requested. Clerk of the Senate being introduced, returned bill from the House of Representatives, numbered and titled as follows. House Bill 327, House Bill 663, House Bill 1853, House Bill 1889. With information the Senate has passed the same, without amendment. Clerk of the Senate being introduced, informed that the Senate has concurred in the amendments made by the House of Representatives to Senate Bill numbered and entitled as follows. Senate Bill 656 and Senate Bill 1246. Bills numbered and entitled as follows. Having been prepared for presentation to the Governor and the same being correct, the titles were publicly read as follows. House Bill 327, House Bill 663, House Bill 1853, House Bill 1889, Senate Bill 656, and Senate Bill 1246. Whereupon the Speaker, in the presence of the House, signed the same.
Chair is about to sign the following bills, which the clerk will now read.
House Bill 327, House Bill 663, House Bill 1853, House Bill 1889, Senate Bill 656, and Senate Bill 1246.
Colleagues, if I can have your attention, the House will come to order. Our colleague that serves Cumberland County, Representative Caucus, brings some special guests to the floor of the House this afternoon. The House will come to order. Representative Caucus, who serves Cumberland County, has brought to us this afternoon Anna Foreman and her mother, Jennifer, Anna is a member of the American Heritage Girls Troop, PA 0304 in Mechanicsburg, Pennsylvania. And very recently, Anna has earned the Stars and Stripes Award, the highest award a Girl Scout can earn. Anna, please stand. Congratulations. Welcome to the floor of the House. The House will briefly be at ease. The House will come to order. Colleagues, the chair just found out Anna graduated high school just a few weeks ago. Congratulations, Anna, class of 2024. Chair recognizes the Majority Leader who calls up House Resolution 411, printer's number 3003 on page 5 of today's House calendar. Clerk will read a summary of the resolution.
A resolution designating the month of July 2024 as Parks and Recreation Month in Pennsylvania, introduced by Representative Fleming.
Will the House agree to the resolution? On that question, the chair will recognize the gentleman that serves Dauphin County, Representative Fleming, the maker of the resolution.
Thank you, Madam Speaker. I rise today to speak on behalf of House Resolution 411, which would designate July as Parks and Recreation Month. Pennsylvania's parks are wonderful places to rest and refresh the senses, the body, and the mind. Studies have shown that spending time in a park provides a variety of physical and mental health benefits, including opportunities to exercise, play sports, hike, swim, and enjoy a variety of activities. Doing an activity or simply strolling in nature also increases cognitive performance and well-being by alleviating illnesses like depression, attention deficit disorder, and Alzheimer's disease. Recreational parks are essential for after-school programs, youth sports, and environmental education that positively enhances childhood education and development. They also increase economic development in our neighborhoods by increasing property values, expanding local tax bases, supporting tourism, and reducing crime. These are all important reasons why I'm introducing a resolution designating July 2024 as Parks and Recreation Month. I hope you will support House Resolution 411. Thank you so much, Madam Speaker.
Chair thanks the maker of the resolution. Those in favor of the resolution will be voting aye. Those opposed will be voting no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the resolution, the ayes are 200, the nays are 2. The resolution is adopted. Chair recognizes the majority leader who calls up House Resolution 460, printers number 3217, on page 5 of today's House calendar. Clerk will read a summary of the resolution.
A resolution designating July 19, 2024 as Parks and Recreational Professionals Day in Pennsylvania, introduced by Representative Fleming.
Will the House agree to the resolution? On that question, Chair recognizes the maker of the resolution, the gentleman from Dauphin, Representative Fleming.
Thank you so much again, Madam Speaker. Madam Speaker, I rise in support of House Resolution 460, which would designate July 19th as Parks and Recreation Professionals Day in the Commonwealth of Pennsylvania. All of the health and educational benefits of our parks would be impossible without the hard work, dedication, and leadership of the professionals who work tirelessly behind the scenes to provide the high-quality programs and facilities we desire and expect in our parks and public spaces. Parks and Recreation Professionals Day is an opportunity to recognize the skilled work of parks and recreation professionals across the Commonwealth who help to strengthen community connections, connect people with nature, and provide environmental sustainability. Please join me in supporting House Resolution 460 designating July 19th, 2024 as Parks and Recreation Professionals Day. Thank you so much, Madam Speaker.
Chair thanks the gentleman. Those in favor of the resolution will be voting aye. Those opposed will vote no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the resolution, the ayes are 200, the nays are 2. The resolution is adopted. The chair recognizes the majority leader who calls up House Bill 1293. Printers number 3502 on page 1 of Supplemental Calendar A. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill requires schools to notify parents and legal guardians when their child is involved in or experiences bullying.
This bill's been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? On that question, the chair recognizes the maker of the bill, the gentlelady from Delaware County, Representative O'Mara.
Thank you, Madam Speaker. I really just want to rise to thank the chairs of the Education Committee, both majority and minority chairs, for their support, and I will submit the rest of my remarks for the record. Thank you, Madam Speaker.
Chair thanks the maker of the bill. Agreeable to the revisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 196, the nays are 6. Majority required by the Constitution. Having voted in the affirmative, the bill passes the House finally. Clerk will return the same information to the Senate. The chair recognizes the Majority Leader who calls up House Bill 2092, printer's number 3143 on page 1 of Supplemental Calendar A. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill provides for automatic return of unclaimed property valued at $10,000 or less and makes changes to unclaimed property process.
Will the House agree to the bill? It's agreed to. This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 202, the nays are 0. The majority required by the Constitution. Having voted in the affirmative, the bill passes the House finally, and the clerk will return the same information to the Senate. The chair recognizes the Majority Leader who calls up House Bill 2339, printer's number 3172 on page 2 of Supplemental Calendar A. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill ensures that the costs for hospital services are publicly available in accordance with federal law and provides patients information about facility fees in advance of procedures.
This bill has been considered on 3 different days and agreed to. Question is, shall the bill pass the House finally? On that question, the chair recognizes the maker of the bill, the gentleman from Philadelphia, Representative Kahan.
Thank you, Madam Speaker. I'll make my comments brief. Each day, patients and employers are unaware of the cost of hospital procedures, and it leads to medical debt. It leads to patients that get surprise medical bills. Pennsylvania lags far behind other states, states like Idaho and Florida, in making sure that their prices are transparent for employers and also for patients. And I'm very proud to have worked on this bill across the aisle with Representatives Rowe, Representatives Kiefer, Representative Tomlinson, also Representative Sanchez and Representative Prokopiak, to make sure that these prices are on websites and is clear for patients to access, and also for employers who have to ensure their employees that they're aware of the health care cost. Thank you very much. I appreciate it. I would appreciate an affirmative vote on House Bill 2339. Thank you.
Chair thanks the maker of the bill. On that question, chair recognizes the gentleman from Mercer, Representative Bonner.
Thank you, Madam Speaker. House Bill 2339 is a bill that will require our hospitals to regularly prepare and update a price list for all standard charges for our hospitals for each item and for each service rendered within the hospital, both for inpatient and outpatient care, in 5 different formats, updated yearly. And additionally, a list of 300 shoppable services required by the Medicare and Medicaid program, with 8 different criteria to be set forth for each service. It is anticipated that these lists and regulations will include hundreds, if not thousands, of hospital items and services, and require the attention of at least several hospital employees. In an article posted yesterday in the Center Square newspaper, Dr. Korba, a primary care physician, said, "When you have more government intrusion and involvement, you have more focus away from the patient." And this particular bill takes the focus away from the patient and puts it on the payment system, exactly what Dr. Cobra criticized by most of this legislation. Frankly, most of the information that is being sought by this particular bill is already required to be disclosed under federal law. There are 3 federal pieces of legislation that already regulate the disclosure of hospital pricing for services within the hospital setting. In addition to the 3 federal laws, numerous regulations have been adopted by the Federal Department of Health and the CMS agency. Most of these regulations, in fact, do not come into place until July 1 of this year, so just 10 days ago, and also January 1 of 2025. So the federal regulations are now just coming into effect. We should give them time to come into effect before we now put on top of federal regulations additional state regulations. The federal government has been very patient with our hospitals since this act was just adopted effective January 1 of 2021. The federal government recognizes the extreme mandate on our hospitals to provide thousands of pieces of information relative to pricing within the hospital setting. And yet, even though this act is nationwide, they have found only 25 violations by our hospitals across the country. None of these violations have been found to have occurred in Pennsylvania. Pennsylvania is already implementing these federal regulations. We do not need state regulations on top of federal regulations. There is a patient rights advocate organization, not a hospital organization, that has found that Pennsylvania hospitals are overwhelmingly in compliance with the federal regulations that started on January 1, 2021, and have just been re-amended effective July 1, 2024, and to be further implemented on January 1 of 2025. Let's give our hospitals an opportunity to comply with these federal regulations that just went into place. You cannot imagine that the federal government, if anything, has over-regulated this pricing requirement. The state regulations on top of the federal regulations is simply an overkill of our hospitals. Hospitals are the most heavily regulated business by the federal and state government. A patient can't even go to the bathroom without it being regulated by the federal government. There are so many regulations in place now on hospitals that they are strangling through these regulations. Let's let the federal regulations, which are already in place and just coming into effect this month and in January of 2025, see if they work before we now put a heavier load upon our hospitals. Our hospitals are in trouble. 71% of our hospitals are in financial distress. We can't continue to load these hospitals with further governmental regulations, particularly when the federal government has entered this arena and put heavy regulations upon our hospitals. You know, in the colonial days, in 1770, there was a group of colonists who very much wanted British regulations to come into play. And they pushed the government for heavy regulation in the colonies at this time. These individuals were known as the regulators. That is not a title that we seek as members of this legislature. There are now 170,000 regulations in Pennsylvania. This bill will add to further regulations. Let's give our hospitals some breathing room to first comply with the federal regulations before we consider pushing more state regulations on them. I would ask then that you slow this process down, that you give our hospitals some breathing room to comply with the federal regulations that are now coming into effect. Let's see if they work. Let's see if they address this problem. And then if they don't, we should go to the federal government and say why it's not addressing the problem, and then and only then should we begin to bring another load of state regulations upon our hospitals. I thank you for your time and your attention.
Chair thanks the gentleman. On that question, Chair recognizes the gentlelady from York, Representative Kiefer.
Thank you, Madam Speaker. There is no functional market in our healthcare system. Where else would you shop for an item or a service, goods, products without knowing what the price is? Our patients, consumers of healthcare, do not have the ability to shop for their healthcare. This bill we have worked on a bipartisan fashion for well over a year, trying to wrap our arms around this. And I think we have this to a point where this will provide at least the transparency piece where consumers can actually look how much is this service going to cost so they can budget accordingly. A lot of people have co-pays. Let's understand what our costs are. This is not a silver bullet to the issue of our rising healthcare costs that are costing our state anywhere between 6 and 8% additional funds every single year increases, but we will get nothing done without this piece of transparency. So I thank my colleagues for working on this piece of legislation with me, and I would encourage and ask for my colleagues' support. Thank you, Madam Speaker.
Chair thanks the gentlelady. On that question, Chair recognizes the gentleman from Allegheny, the Majority Chair of Health, Representative Frankel.
Thank you, Madam Speaker. I certainly want to concur with my colleague from York who just spoke and thank all of the bipartisan work that went into this piece of legislation led by my colleague from Philadelphia. It is truly a work of collaboration. Untangling all that is wrong with our healthcare system is an enormous job. But until every Pennsylvanian has access to high-quality health care, that task is before us as legislators. Today, we have the chance to take a small but crucial step in that direction. With House Bill 2399, we can insist that healthcare providers, payers comply with federal regulations that require transparency in the cost of healthcare services. Unfortunately, while the federal government has been explicit about the aims of transparency regulations, compliance has been spotty at best. That's why states have stepped in to make sure that for their residents, the data is available and usable. The largest portion of House Bill 2399 is simply a directive to hospitals to comply with federal law, requirements that both President Biden and former President Trump used their powers to strengthen. Because Democrats and Republicans can all agree we cannot fix a system that is being deliberately obscured from our view. House Bill 2399 also would make sure that additional facility fees, which get added on when hospitals buy up other offices, get reported. Accurate health care pricing data will allow us legislators, to do our job untangling and improving health care in this Commonwealth. I'm very proud of how this legislation came together with meaningful contributions from all parts of our political spectrum. I think the result can make you all proud as we lay crucial groundwork for future improvements. I ask for a yes vote. Thank you, Madam Speaker.
Chair thanks the gentleman. Agreeable to the provisions of the Constitution, the ayes and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 168, the nays are 34. The majority required by the Constitution having voted in the affirmative, bill passes the House finally, and the clerk will return the same information to the Senate. The chair recognizes the majority leader who calls up House Bill 2344, reference number 3503, on page 2 of Supplemental Calendar A. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill codifies existing powers of the Attorney General related to healthcare mergers and provides for advanced notification of mergers and acquisitions.
This bill's been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? On that question, the chair recognizes the maker of the bill, the gentlelady from Delaware, Representative Borowski.
Thank you, Madam Speaker. Hospitals are a lifeline in our communities. As the daughter of a pulmonologist and critical care specialist and someone who spent more than 30 years working in hospitals and healthcare systems myself, I know all too well the essential role hospitals play in our communities when it comes to health and wellness. But equally important, and something we don't often consider, is the social and economic stability they represent as they seek to address social determinants of health and serve as major employers. Unfortunately, there are many parts of our state where access to health care is limited at best, places where preventive health care is a luxury. Across our Commonwealth, there is a growing number of healthcare deserts, and this is due to the steady increase of health system consolidations and closures. The results can be devastating. Fewer healthcare choices and cost increases for patients, the stifled ability for healthcare professionals and staff to negotiate better wages, and in extreme cases, closures often after private equity firms buy up health systems and strip them of their assets. A staggering 14 of the last 15 hospital closures in the last 5 years in Pennsylvania occurred following a merger or acquisition. Crozier Health System, Hahnemann Hospital, Elwood City Hospital, Bucktail Medical Center, and Sharon Regional Medical Center are all examples from the last few years of private equity owners leaving hospitals to collapse and leaving communities behind. Right now, our Attorney General has some ability to review sales involving nonprofit health facilities, but it is limited. Today, we consider House Bill 2344, which strengthens oversight by the Attorney General over hospital acquisitions and consolidations. It provides a mechanism to allow the Attorney General to determine if the transaction is in the best interest of the community. These provisions would now require health systems to file timely notice and relevant documentation. It gives the Attorney General the authority to seek legally binding agreements from merging health systems to preserve health services rather than unenforceable promises that are typically announced with mergers. It allows the Attorney General to block leveraged buyouts and other Wall Street financial tricks to raid hospitals of their assets and leave them with massive debt. My colleagues in Delaware County have seen this happen in real time. It allows the Attorney General to challenge large shareholder dividend payments to hospital owners when such payments threaten the financial viability of a health system. It also allows the Attorney General to vet the finances of an acquiring entity to ensure that they have the financial strength to run a successful health system in the long run. This bill also includes many revisions which demonstrate a considered effort to do no harm. Removing the financial penalties, changing the cost sharing, increasing the implementation timeline, and changing the financial threshold for review represent a considered collaboration between my colleagues and many stakeholders. Healthcare delivery in Pennsylvania is in crisis. This bill is designed to keep bad actors from further decimating a weakened system. I look forward to working with my colleagues to continue to address some of the systemic issues which force hospitals into situations where mergers or consolidations become a last resort. Our hospitals and our providers need to address rising costs and decrease reimbursements, the growing number of uninsured and underinsured, and the issue of uncompensated care, which is severely impacting some of our most important safety net hospitals in urban, suburban, and rural communities. I urge my colleagues to join me and my co-prime, Representative Takak, in supporting House Bill 2344 and help take an important step in protecting and preserving health care access in our Commonwealth. Thank you, Madam Speaker.
Chair thanks the maker of the bill. On that question, Chair recognizes the gentlelady from Warren, Minority Chair of Health, Representative Rapp.
Thank you, Madam Speaker. I'm pleased to see that some of the issues that I raised in committee were addressed with the amendments adopted here on the floor. However, the amended bill does not go far enough to address my primary concern that House Bill 2344 will further harm an already vulnerable health care community. Unfortunately, my colleague from Mercer County had several amendments yesterday that I believe would have addressed more of those concerns, but those amendments were tabled. This bill, while attempting to address issues with hospital consolidations and mergers, presents a high likelihood of unintended negative consequences. I am particularly concerned the legislation will have a chilling effect on the ability and willingness of more stable partners to intervene with at-risk entities and preserve high-quality care in vulnerable communities. Mergers and acquisitions are often the final straw that hospitals seek to keep their doors open, making it more difficult and more costly to do so will only increase the likelihood that hospitals will continue to close. According to a recent report from the Pennsylvania Healthcare Cost Containment Council regarding the fiscal year 2023 financial analysis for general acute care hospitals, the following information was provided. More than half of Pennsylvania's general acute care hospitals are operating at a loss, an increase of nearly a third from 39% in fiscal year 2022. Another 15% posted an operating margin of less than 4%, which is not sustainable long-term. Hospitals face multi-year losses. The statewide average operating margin, which was 2.26% for fiscal year 2023, was cut in half for the second consecutive year. The share of hospitals that lost money over 3 years increased to 33% for fiscal years 2021 to 2023 from 27% for fiscal years 2020 to 2022. Hospitals that receive more than half their patient revenue from Medicare and Medicaid are more than twice as likely to operate at a loss. Among hospitals with negative operating margins, 81% relied on government payers for at least half of their patient revenue, compared to 41% of those with positive margins. According to the Philadelphia Business Journal, 21 of the 37 Philadelphia area hospitals lost money in 2023. Suburban Philadelphia was the most financially strained region with a negative 6.47% operating margin compared to 2.26% statewide, which was a decrease from fiscal year 2022 when the statewide operating margin was 4.37%. According to the Pittsburgh Business Times, UPMC alone lost $103 million in the first quarter. UPMC Mercy had a negative 25.01% operating margin in 2023. UPMC McKeesport operated at negative 21.27%, Penn Highlands, Mon Valley at negative 13.89%, Heritage Valley Kennedy at negative 51.97%, and Allegheny Health Network's Allegheny Valley Hospital at negative 17.08%. Pennsylvania's hospitals, like the rest of the country, have been suffering under the weight of higher costs for labor and supplies, as well as reimbursement rates from Medicare and Medicaid that haven't been able to keep up with the cost of inflation. I'm not ignoring what's going across the Commonwealth with hospital mergers and acquisitions. I do not believe this bill is the solution. I do appreciate the prime sponsor's desire to stabilize the hospital industry with this bill. However, given the information that has been provided, I must respectfully oppose House Bill 2344. Thank you, Madam Speaker.
Chair, thanks the gentlelady on that question. Chair recognizes the gentleman from Mercer, Representative Bonner.
Thank you, Madam Speaker. President Ronald Reagan is credited with winning 2 debates with President Jimmy Carter and Vice President Walter Mondale, when the 2 Democratic leaders allegedly misstated President Reagan's record, and President Reagan responded with the phrase, "There you go again." Well, here we go again. A 5th major bill to regulate our nonprofit hospitals this session. This bill regulates the merger of hospitals in Pennsylvania, requiring the review and approval of the Attorney General's office. Frankly, as to the 137 nonprofit hospitals in Pennsylvania, this legislation is not needed. The Attorney General already has the power under several statutes and under common law to regulate the mergers of nonprofit hospitals. I have participated in such proceedings, and the Attorney General has flexed its muscle and offered, frankly, wise counsel in those proceedings. But they have the power. They do not need this legislation to regulate nonprofit hospitals. As to for-profit hospitals, have a go at it, and I'll be there supporting you in this legislation. We should have legislation to regulate for-profit mergers, but not for nonprofit mergers. But if you say the Attorney General needs further power to regulate nonprofits, I say to you, we gave that power to them last week when we adopted the antitrust bill, which interestingly was a general antitrust bill regulating all businesses in Pennsylvania except for one. You specifically picked out, singled out hospitals, and they today are asking why. Why are we such a target by this session of the General Assembly? This merger bill gives the Attorney General 13 reasons to deny a merger, including a broad power that any factor the Attorney General finds not to be in the public interest can result in a denial of a merger. This one power, this one factor gives the Attorney General too much authority over mergers. I tried to improve this legislation with an amendment, and this amendment said that if the merger in any way would enhance health care within the acquired entity's community, then the merger should be approved by the Attorney General. And that's exactly what we want mergers to do, to enhance the quality of care in the acquired area. But yet, that amendment, unfortunately, wasn't even given any consideration. But yet, isn't this the standard we want for a merger? If we show improved health care within the acquired territory, shouldn't we be approving mergers of hospital systems? A second amendment that I proposed, and it was not considered also, put a time requirement on the Attorney General that if they opposed the merger, they had 30 days to file a court action seeking to support their decision. This bill says they can do it at any point in time, 6 months, 1 year, 2 years after the merger. Can you imagine the chaos that will occur in these merged territorial districts of hospitals, where the Attorney General 6 months, 12 months, 2 years later can seek to attack the merger. They should have a time limit by which they go to court to seek it aside. That's what my amendment would have required, but unfortunately, that amendment was not considered either. There were 5 other amendments that I suggested to improve this bill. Having been involved in these mergers, those amendments would have strengthened this bill. Yet, unfortunately, none of those were considered either. Actually, this bill is looking at how mergers occur. Frankly, that's not the issue we should be studying. The issue that we should be studying is, why are these mergers occurring? And frankly, they are occurring because the government is forcing hospitals to take care of patients who are uninsured or underinsured or on governmental programs, and those payments to our hospitals do not nearly pay the cost of care. That's the true issue. We should be examining ourselves, not the hospitals, relative to how they merge. I would suggest then that we give our hospitals a break. We've been attacking them bill after bill after bill after bill after bill in this session. 5 major regulatory bills. In the words of President Reagan, today, here we go again.
On that question, Chair recognizes the gentleman from Allegheny, the Majority Chair of Health, Representative Frankel.
Thank you, Madam Speaker. To my colleague from Mercer County and my co-chair from Warren County, whose work I've much appreciated on the Health Committee, I just would say, with respect to the issue of for-profit versus nonprofit healthcare systems, that has become so blurred in today's world. What is really a nonprofit and a for-profit, the way some of these healthcare systems behave in our communities. In addition to which, when you take a look and analyze profitability, or at least positive cash flow, I think you have to analyze what happens when you have these integrated delivery networks. We have the provider side and the insurance side, and they've come together. One side may be losing money, the other side is making a lot of money. And we don't get that analysis. So for a couple of decades now, I've had a front row seat to consolidation in healthcare as rival systems gobbled up independent hospitals across southwestern Pennsylvania. We don't have to wonder what happens to patient care when that occurs, because we've seen it play out again and again. When healthcare systems buy up their competition, local market pressures evaporate. That's when we see higher costs without higher quality, reductions in services, and movement away from local control. As the healthcare industry is reshaped by consolidation, our regulations must also be reshaped. House Bill 2344 gives this Commonwealth tools to prevent the harmful impacts of consolidation. Without the pressures of competition to encourage healthcare systems to listen to their better angels, it is up to us to ensure that the larger systems seek to grow, it's not at the expense of our local communities. With this legislation on the books, we can restore some balance to our healthcare sector in favor of Pennsylvania's patients and our communities. We can make sure that issues like local jobs and community need are not cast aside or easily outweighed by profit margins. Pennsylvania patients and communities deserve someone watching out for their interests when it comes to healthcare providers. And this again is another bipartisan effort that's been worked on in our committee. It has bipartisan support, and I want to thank in particular my colleague from Delaware County, who brought a lot of her experience to this issue, and appreciate her work, and my other colleagues on the Health Committee on both sides of the aisle who participated in getting this bill this far. So I would ask my colleagues to support this with a yes vote, and I thank you, Madam Speaker.
Chair thanks the gentleman. On that question, chair goes to the floor leader, Representative Cutler from Lancaster.
Thank you very much, Madam Speaker. Madam Speaker, I appreciate my good friend from Allegheny County, the Majority Chair. He and I both have the privilege of serving on the Pennsylvania Healthcare Cost Containment Council together. So we obviously review the data that is related to the costs. And it is in that data I'd like to expand a little bit as to why I have major concerns about this proposal, because I think the gentleman from Mercer County appropriately flagged the correct issue, and that is why are there so many mergers and consolidations happening? Madam Speaker, if half the hospitals are currently operating at a loss, we have to ask ourselves, why are they operating at a loss? And the prime sponsor of the bill is correct. It is in large part due to uncompensated care and lower reimbursement rates, specifically lower reimbursement rates of government-funded insurance. Two biggest providers or payers in the healthcare system is Medicare, which you qualify for by age, and Medicaid, which you qualify through income levels. And when you break into their reimbursement levels and compare what they reimburse as compared to commercial insurance, we are woefully inadequate. Specifically, the Pennsylvania Healthcare Cost Containment Council, or PHC4, issued a report a little over a decade and a half ago that highlighted that Medicare reimbursement rates underfunded the actual cost to provide services by about 16 cents on every dollar. Medicaid lagged even further behind than that. What does that mean for many of our providers? And this is an area where the rural and the urban centers have a lot of overlap, because in both patient populations, there's a high occurrence of government insurance. Even in Lancaster, 20 years ago, 55% of all the government-funded insurance that we saw was Medicare and Medicaid. 55% of all of our reimbursement rates were government-funded, which meant 55% of the actual cost to provide services were not actually being paid for. That was cost shifted onto those who have private insurance, and in our case in Lancaster County, a large plain sect population that pays cash. Madam Speaker, the answer to why hospitals continue to consolidate and merge because they're losing money does not lie in more government mandates. It does not lie in staffing ratios that are mandated by the government and then not properly funded. And it does not rely on involving the Attorney General more frequently, which will increase processes and add cost. The best way to help our small, rural, and small urban hospitals survive that have a disproportionately high number of Medicaid and Medicare patients, Madam Speaker, that answer lies right here with us. We can increase the Medicaid reimbursement rates in the budget, which we will hopefully get to later today. Sadly, all too often, we as government are exactly what contributes to these skyrocketing costs and losses. For example, we will provide that certain kinds of services must be covered, and then we don't appropriately fund them in the budget. That's a problem, because those costs are then shifted to other non-government sources. Madam Speaker, we do not need additional oversight by the Attorney General. What we need is additional funding in the Medicaid lines to prevent those losses from ever occurring, and at a bare minimum, at least covering the actual cost to provide those services. That is not currently happening. I do not expect it to happen in the upcoming budget, but if we want to save hospitals, we can start by paying our bills and not including more government oversight in this manner, because this government oversight will simply add cost, and the underlying problem will continue to persist, and hospitals will continue to struggle and lose money based on the fact that they are providing a disproportionate amount of uncompensated and undercompensated care. That, Madam Speaker, is the real issue. We can look in the mirror and find the solution. We don't need another bill.
Agreeable to the provisions of the Constitution, the ayes and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 114. The nays are 88. A majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will present the same information to the Senate. The chair recognizes the majority leader who calls up Senate Bill 209, printers number 0839, on page 4 of today's House calendar. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill amends the Public School Code to allow a student that is a child of a member of the National Guard or Reserve the same rights as a student of an active duty military family under the Interstate Compact on Education and Opportunity for Minority Children Act.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 202, the nays are 0. Majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will return the same information to the Senate. Then the House has passed the bill without amendment. The chair recognizes the majority leader who calls up Senate Bill 559, printers number 1292, on page 3 of today's House calendar. Will the House agree the bill is agreed to? The clerk will read the title and a brief description of the bill.
This bill clarifies definitions for athletic trainers in the Medical Practice Act.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 201, the nays are 1. Majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will return the same to the Senate with the information that the House has passed the bill without amendment. The chair recognizes the majority leader who calls up Senate Bill 560, printers number 1293, on page 4 of today's House calendar. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill clarifies definitions for athletic trainers in the Osteopathic Medical Practice Act.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 201, the nays are 1. Majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will return the same information to the Senate. Then the House has passed the bill without amendment. The chair recognizes the majority leader who calls up House Bill 2216, printers number 3498, on page 1, supplemental calendar B, for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? On that question, the chair recognizes the gentleman from Montgomery County, Majority Chair of Judiciary, Representative Briggs.
Thank you, Madam Speaker. This is the conveyance bill. The Senate added a couple items. I agree with those items, and I encourage a yes vote. Thank you.
Chair thanks the gentleman. The gentleman from Venango, Representative James, is excused from voting on House Bill 2216 due to a conflict. Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the concurrence to the Senate amendments. The yeas are 201 and nays are 0. Majority required by the Constitution having voted in the affirmative, the amendments are concurrent, and the clerk will inform the Senate accordingly. The chair recognizes the majority leader who calls up House Bill 1993, printers number 3499 on page 1, supplemental calendar B, for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? For that information, the chair will recognize the gentlelady from Allegheny County, Representative Benham, for a brief description of the Senate amendments.
Thank you, Madam Speaker. I'll do my best to be brief. There were a significant number of changes. The Senate amended version contains similar provisions to what we passed in the House with regard to scrivener's errors, clawbacks, network adequacy, patient steering, and transparency. However, it removes the prohibition on spread pricing, instead requiring a study of spread pricing. It also removes the provision preventing PBM pharmacy contract requirements specific to pricing of drugs, as well as the steering provisions that stopped advertising as a means of steering and those that blocked steering entirely unless pharmacy contracts were different. The Senate version creates a large exemption for specialty pharmacies. It also adds registering and reporting of PSAOs, payment parity between affiliated and non-affiliated retail pharmacies, 340B drug pricing protections, limitations of designation of specialty drugs, a requirement that 95% of rebates be passed through to insurer or plan. It stops the automatic transfer of prescriptions and auto enrollment in mail order except for regular meds for chronic conditions, and even then an opt-out must be allowed. Finally, the Senate version expands scope for pharmacists, technicians, and pharmacists as a means of increasing opportunities for revenue for pharmacies. It allows for the provision of injections in accordance with the Federal PrEP Act. It also allows for pharmacists to order and perform lab tests for COVID-19, the flu, RSV, and strep. There are additional required reports in the Senate bill, including reporting on impact of scope of practice changes for pharmacies, reporting on the impact of spread pricing and steering on the cost of drugs, a study on the potential costs of a floor drug and dispensing fee, as well as reports on aggregate rebates by PBMs. I know that was a lot, but it does deliver real relief to our community pharmacies and the pocketbooks of patients, and I hope folks vote to concur on Senate amendments. Thank you.
Chair thanks the gentlelady for the brief description of the Senate amendments. On that question, chair recognizes the gentleman from Lebanon, Representative Diamond.
Thank you, Madam Speaker. I rise to encourage a no vote on concurrence for House Bill 1993, Madam Speaker. This bill, when it went to the Senate, I voted for. And it was intended to provide for some important transparency for the practices of pharmacy benefit managers, and to provide relief for our community pharmacies. But while I support many of the provisions, even that the Senate amended in, I'm extremely concerned about the scope of practice changes that came with the amendment from the Senate. House Bill 1993, as amended by the Senate, repeals certain scope of practice sections for pharmacists, pharmacy interns, and pharmacy technicians out of the Pharmacy Act and places them into the PBM law, leaving the oversight over these professionals and this practice in limbo. Furthermore, House Bill 1993 significantly expands upon a pharmacist, pharmacy intern, and pharmacy technician's ability to administer injectable medications, biologics, and vaccines. If this bill goes into effect, pharmacists and pharmacy interns will be able to administer any vaccine, injectable medication, or biologic to anyone 8 years of age and older. Pharmacy technicians who cannot currently give any vaccines, and the Commonwealth, just began regulating them, will be able to administer the flu and COVID vaccine to those 13 and older. And I will remind you, Madam Speaker, that for those pharmacy technicians, they only began being regulated by the Commonwealth, and quite frankly, those regulations are still before IRC. They're not even finalized yet. So you could be talking about someone who's 17 years old and is only working part-time. That's a huge concern for me, especially in the post-COVID era. This bill also lacks some extremely important safeguards that we've been talking about related to another bill that has been offered by my good friend, the gentlelady from Philadelphia. Safeguards such as requiring a prescription from a primary care provider, and that sort of thing. Look, here's the thing. I think that in this day and age, we need to take a little step back. And when you're allowing someone new to inject something into someone's body, I think that person ought to have a little bit more idea of that individual's medical background than a pharmacy or a pharmacy intern or a pharmacy tech will have. I think it's time to take a closer look. And regardless of the fact that I support every other provision that has been amended into this bill, and as the prime sponsor noted, it's been significantly revised, I cannot vote to concur on this bill when these particular issues regarding injectables, biologics, and vaccines are included. Madam Speaker, I know that other states are doing this, but just because every other state is doing this does not mean that this body should leap into that fire. And Madam Speaker, I understand that some of the things that I'm talking about here, we started during COVID as a waiver. But as we all well know, a lot of the things we did during COVID were not all that good. Some of them were good, we kept them. But some of them we really need to question. Madam Speaker, I believe the amendment goes one step too far in including these injectables, biologics, and vaccines for pharmacists, pharmacy interns, and pharmacy techs. For that reason, Madam Speaker, I ask my colleagues to vote to non-concur on House Bill 1993. Thank you, Madam Speaker.
Chair thanks the gentleman on that question. Chair recognizes the gentleman from York, Minority Chair of Appropriations, Representative Grove.
Thank you, Madam Speaker. I'd like to correct the record on some things that were said on the floor today on this bill. Number one, a child was just immunized by a pharmacist. That just happened because it's allowed to happen. It was actually an individual was just immunized by a pharmacy tech. Why? Because it's allowed to happen. This has been happening for over 3 years. Other states have been doing this for years. Why? Because pharmacists are doctorates in pharmacology. Their job literally is to protect individuals from doctors' prescriptions. They look at the prescription drugs and make sure they're not killed by that. That is their job. Doctors don't have that training. Let's talk about pharmacy techs. Pharmacy techs, under current law and rules, they work in a pharmacy under the direct and immediate and personal supervision of a pharmacist and assist pharmacists in the practice of pharmacy by performing technical and administrative tasks that do not require pharmacist professional judgment. They must possess a high school diploma or equivalent, must complete a board-approved pharmacy technical training program, Pennsylvania pharmacy technicians who meet certain training requirements are currently temporarily authorized to administer vaccines under the Federal PrEP Act. Those training requirements are as follows. Complete a practical training program that is approved by the Accreditation Council for Pharmacy Education that includes hands-on injection technique and the recognition and treatment of emergency reactions to vaccinations. Maintain a current certificate in basic CPR. Complete a minimum of 2 hours of CPEA-approved immunized-related continuing pharmacy education during relevant state licensing periods. If you're a medical assistant and you work in a medical office performing work that is delegated to them by a physician or other licensed healthcare, there is no education requirements for this individual. All you need is high school diploma or GED. Despite that, they are allowed to administer vaccinations. A nurse's aide. It's an individual providing nursing or nursing-related services to residents in a nursing facility or skilled nursing facility. They're allowed to give vaccinations. Far less training, far less requirements. That's the current practice here in the Commonwealth of Pennsylvania. So if you have concerns of a trained pharmacist or pharmacy technician who meets those requirements, your real concern should be in doctors' offices and nursing facilities in this Commonwealth of Pennsylvania. Further, we've been doing COVID vaccinations, flu vaccinations in this Commonwealth. If this stops, rural Pennsylvania will be without access. So if you're a parent who can't get into your doctor's office, which happens every single day, I got 3 kids, happens. It took me 6 months to get my daughter a wellness check. 6 months. This allows that access for you as a parent to get your kid in if you have mandated immunizations under current law. You don't need to go to your doctor's office. This is about access for rural Pennsylvania, that once the PrEP Act goes away and this bill doesn't pass, your parents are going to come knocking down your door because they're not able to get those vaccinations done in a timely fashion. So what do we know? Adverse reactions. We haven't seen it. 3 years this has been going on in this Commonwealth. We haven't seen it. It doesn't happen. So this is safe. This is common sense. Pharmacy groups, your independent pharmacists are supportive of this legislation. It's common sense. I appreciate the gentlelady's work in this field on this bill. Let's send it and continue lower costs in health care and better access. Thank you, Madam Speaker.
Chair thanks the gentleman. Agreeable to the provisions of the Constitution, the ayes and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted?
Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 172, the nays are 30. The majority required by the Constitution having voted in the affirmative. The amendments are concurred in, and the clerk will inform the Senate accordingly. Chair recognizes Majority Leader who calls up House Bill 1032, printers number 3495 on page 1 of Supplemental Calendar B for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? The chair recognizes Representative Fiedler for a brief description of the Senate amendments.
Thank you, Mr. Speaker. The Senate made some technical changes in their amendment, and they were agreed to.
Chair thanks the gentlelady. Agreeable to the provisions of the Constitution, yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? The clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 112, the nays 90. The majority required by the Constitution having voted in the affirmative. The amendments are concurred in, and the clerk will inform the Senate accordingly. The chair recognizes the majority leader who calls up Senate Bill 1009, printer's number 1813 on page 3 of today's House calendar. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill makes appropriations from a restricted revenue account within the general fund and from the federal augmentation funds to the Pennsylvania Public Utility Commission.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the final passage of the bill, the yeas are 173, the nays 29. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate with the information that the House has passed the bill with amendment in which the concurrence of the Senate is requested. Chair recognizes the Republican whip, Representative O'Neill, for an announcement.
Thank you, Mr. Speaker. I rise to correct the record.
Gentleman's in order and may proceed.
Thank you, Mr. Speaker. Representative Coffer on House Bill 1032 was recorded in the negative. He wants to be recorded in the positive.
Your remarks will be spread across the record. Chair thanks you, gentlemen. Chair recognizes the Minority Caucus Chairman for a caucus announcement. Gentleman's in order.
Thank you, Mr. Speaker. Republicans will caucus immediately. We will be prepared to be back on the floor at 5 o'clock. Thank you, Mr. Speaker.
Chair thanks you, gentlemen. Chair recognizes the Majority Caucus Chairman, Representative Schlossberg.
Thank you, Mr. Speaker. For the information of the Democratic Caucus, we will not be holding a caucus at this time.
The House stands in recess until 5 o'clock unless sooner recalled by the Speaker.
The hour of 5 o'clock having arrived, the House will come to order. The chair referred the following bills, which the clerk will now read.
Referrals July 11th, 2024. House Resolution 496 to Commerce. House Bill 2495, House Bill 2496, both to Consumer Protection, Technology, and Utilities. House Bill 2493, Education. House Bill 2491 to Finance. Senate Bill 1026, Senate Bill 1232, Senate Bill 1274, those three to Labor and Industry. House Bill 2492 to State Government. House Bill 2494, Transportation. Senate Bill 1160 to Veterans Affairs and Emergency Preparedness.
Chair recognizes the Majority Leader who calls up Senate Bill 24, printers number 814 on page 2 of Supplemental Calendar A. The printer's number is 1814 on page 2 of Supplemental Calendar A. Will the House agree the bill is agreed to? The clerk will read the title and a brief description of the bill.
This bill provides statutory authority for the Treasury Department to establish the Pennsylvania Money Match Program.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 202, the nays are 0. Majority required by the Constitution having voted in affirmative. Bill passes the House finally, and the clerk will present the same to the Senate with the information that the House has passed the bill with amendment in which the concurrence of the Senate is requested. The chair recognizes the Majority Leader who calls up Senate Bill 1001, printer's number 1817 on page 1 of Supplemental Calendar C. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This is the General Appropriations Bill for fiscal year 2024 through 2025.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? On that question, Chair recognizes the gentleman from Lawrence, Representative Bernstein.
Thank you, Madam Speaker. Madam Speaker, this GA bill, which is spending nearly $50 billion, that's 50 with a B, billion dollars, is the worst budget that I have seen in the 8 that I have worked on or been here so far. This budget is clearly a budget built by politicians for politicians. This budget has a 12% increase in the governor's office, I don't think Pennsylvanians across the board had a 12% increase in their paychecks last year, but the governor will. It has an 8.3% increase for the legislative branch. That's both the House and Senate combined. I don't think Pennsylvanians received an 8.3% increase, but don't worry, folks at home, the House and the Senate will be able to spend 8.3% more money. The part that's the most ironic is the budget that is indeed late, number one, is then done by the Appropriations Committee. And the Appropriations Committee then works with the governor's office, and the Appropriations Committee gave themselves also 10% more money to spend next year. So what we've seen is the Appropriations Committees, who spends more of taxpayer money, ask for more taxpayer money for themselves to spend more time to spend more taxpayer money. All of this while the oversight mechanism for these funds, the Auditor General, was flat funded. So don't worry, we'll give ourselves a raise here, but we're not going to be able to spend any more money to tell us where we actually just went and spent the money. What we've also seen is there is nothing in here to help all students. At 2:06 p.m. today, the Democrat Caucus tweeted out, "We're fighting to ensure every child in every school gets a quality education that they deserve." The problem, Madam Speaker, is some of those schools aren't real quality. And how we know that is that of high schools, from many of the ones that we're clapping over here, 33 of them have 0 students in the entire school, high school, that can do mathematics. There are 6 of them that do not have a single student that is at reading grade level. Now, the good part is there's a 17.7% increase in the Historical Museum Commission. So hopefully those students will be able to go there, though they may not be able to do the math or actually read what they're trying to understand at the Historical Museum Commission. The most offensive part of this budget is this, that we are spending over $3.5 billion more than we're bringing in. As a result of that, there will be tax increases in the near future. But I'm here to tell you the way Harrisburg works, and that's this. It won't be this year. It'll be next year in a non-election year. Write it down, watch it. That's what this budget will be. So we're focused on making sure that every student, though clearly not every student, has the opportunity to learn. And we're making sure that the governor's office gets a 12% increase. The politicians in Harrisburg get to spend more of their money, more of your money. And as a member over here just said, thank you for those of you that couldn't hear at home. So remember this when we vote for it. And for those of you at home, remember this in November. Thank you.
Chair thanks the gentleman. Chair seeks additional speakers on final passage of Senate Bill 1001. Now is the time. Chair recognizes the gentleman from Adams, Representative Ecker.
Thank you, Madam Speaker. Today I stand before you to address the proposed budget plan that seeks to tap into our state surplus, not to help reduce any financial burdens for our citizens, but rather to expand government and increase costs. This proposal, which includes an unprecedented growth in spending, is short-sighted in its approach to fiscal management. Our savings account is our financial safety net, a reserve for unseen circumstances and emergencies. It represents the hard-earned contributions of Pennsylvanians set aside to ensure that our state remains financially stable in times of need. However, the current budget proposal aims to use these savings to create new programs and to expand the reach of government. This is not a sustainable solution. A savings account is not a renewable resource, nor is our surplus. Once these funds are exhausted, they will be gone, with no plan to replenish them. Inevitably, we find ourselves in a position where the programs initiated by this budget will lack the necessary funding to continue them. This will lead us down a path where the only option is left to increase taxes or cut essential services. Pennsylvanians already face significant financial burdens. The prospect of higher taxes or loss of services is just not appealing. It is unacceptable. Our citizens should not have to bear the weight of increased taxation due to poor fiscal planning and irresponsible budgeting. Instead of using a temporary surplus to expand government, we should be focusing on measures to provide immediate relief and long-term benefits to our citizens. This could be achieved by reducing the income tax, the gross receipts tax, both of which would directly offset costs for all Pennsylvania hardworking families and businesses. Reducing the income tax would put more money back into the pockets of Pennsylvanians, giving people more disposable income to spend and invest in their communities. It would also make our state more attractive to potential residents and businesses, fostering economic growth and development. Madam Speaker, similarly, cutting the gross receipts tax would benefit businesses and families across Pennsylvania. This utility tax can be particularly burdensome for small businesses and seniors, and would reduce or eliminating it could encourage entrepreneurship, support local businesses, or create a more vibrant and competitive community. We must prioritize fiscal responsibility and the well-being of our citizens over the expansion of government programs. Any extra revenue should be preserved for genuine emergencies and unforeseen needs, not depleted to fund initiatives without sustainable backing. Let us take a prudent approach to budgeting. Let us provide relief to our citizens by cutting taxes and ensuring that our financial reserves remain intact for the future. By doing so, we can promote economic growth, support our communities, and secure a prosperous future for Pennsylvania. Thank you, Madam Speaker.
Chair thanks the gentleman. Chair seeks final speakers before going to the appropriation chairs. Chair recognizes the gentleman from York, Representative Grove.
Thank you, Madam Speaker. My apologies. Tonight, I'm sure we're going to hear quite a bit about how great the spending is in this budget. We'll hear about how well some school districts do. We'll hear about increases for various departments and special interest line items. But we won't hear is all the facts. It's important, Madam Speaker, we not only be completely factual, but factually complete. Yes, this budget spends more money than ever before, and sure, some of that money might be for worthy projects, but this is not factually complete. This budget before us today spends a total of $47.6 billion in this current fiscal year, increasing state appropriations by $2.7 billion, or 6% over the prior fiscal year. Upon taking office in January 2023, the governor inherited an $8.1 billion general fund surplus. With the passage of this General Appropriations Act, the governor will have spent that down to $3.2 billion. Think about that for a second. In 2 budgets, our surplus will have been reduced by $4.9 billion. And what will he have gotten for it? Has state government changed all that much? Do constituents tell you, thanks for spending more money? Has it really improved government service? I don't get those calls, and I doubt this budget will change much of anything. Let's dive into the facts a little bit more when it comes to spending and revenues. In fiscal year 23-24 budget, spent $1.9 billion more than state revenues were collected. $1.9 billion more than state revenues collected. This budget spends $3.3 billion more than anticipated revenues to be received within the fiscal year, adding to the structural deficit the Commonwealth already faces. The governor is estimating that revenues will increase by $1 billion over the next fiscal year. Did you know that last year's year-over-year tax revenue growth was only 0.2%? 0.2% year-over-year tax revenue. But again, Madam Speaker, it is important to both completely, factually, and factually complete the general fund did grow last year by 1.2%. However, that growth wasn't due to taxes. It was led by interest payment returns on the surplus thanks to wise investments from the Treasurer. Treasurer Garrity has strategically taken advantage of federal interest rates. However, the combination of reducing the surplus by another $3.1 billion and the likelihood of interest rates decreasing, there goes that revenue. Of course, our other area of significant revenue growth was in the inheritance tax. But I sure hope that doesn't continue because we do need people working in this Commonwealth. Make no mistake, this budget is entirely dependent on our budget surplus to stand up. It's really no different, Madam Speaker, than dipping into your 401k to pay for your vacation today, with no regard for your future needs just because you have the money. With just under $7 billion in the rainy day fund, the level of spending, including in Senate Bill 1001, will require the need to dip into the rainy day fund in just 2 budget cycles next year in order to continue to balance the Commonwealth's finances. The focus of this budget is on spending today without regard for the future. In addition to the massive spending increase, this budget will add over $900 million in new debt to the Commonwealth, which will take decades to pay off. I offered an amendment to move the PA Sites program to be paid out through the surplus, because this is exactly what we should spend the money on, one-time expenses with long-term positive returns. Now we know why my amendment wasn't accepted. When this bill is signed into law, the surplus will pretty much be gone. Madam Speaker, President Thomas Jefferson said, quote, "We might hope to see the finances of the Union as clear and as intelligible as the merchant's books, so that every member of Congress and every man of mind in the Union should be able to comprehend them, to investigate abuses, to consequently to control them." When you take the information we have and examine our budget, it's clear. We cannot afford to sustain this level of spending. I'd like to point out, Madam Speaker, this budget makes some interesting investments in education. I'd like to talk a few moments about school districts, because when you really look at this budget, there are a lot of haves and have-nots. So let's talk about some. When I look at the spreadsheet of school district funding, particularly for the Ready to Learn block grant, the new $526 million, that's the largest share of education funding in this Commonwealth. I see the city of Philadelphia got a $136 million increase. That's huge. It's huge. You should applaud that. That is amazing. Pittsburgh School District got 0. Now, being a Steelers fan, it pains me to say this, but I guess the Eagles are better than the Steelers when it comes to budgeting. Pains me to say. I bleed black and yellow. Pains me to say. When I look at the county of Montgomery, I see a lot of zeros in Montgomery County for those school districts. Upper Dublin, Upper Marion, Upper Moore, Upper Perkiomen, Springford, Springfield, Hattsboro, Horsham, Jenkinstown. Norristown got a big chunk, $6 million. If I'm a Montgomery County legislator, I might not like that funding my school district is going to go with all those zeros and that large stake of dollars. Doesn't work well. So we have a large share with a lot of zeros to school districts behind them. I would be very cautious of making a big vote with all that $526 million going everywhere else. I don't know how I explain that to my school boards back home. But I'll conclude with this, Madam Speaker. Today, I warn. I know the result of this is probably passage of the fiscal year budget heading to the Senate, heading to the governor's desk. The surplus will be gone next year, and this body will be looking for billions of dollars in new revenue. So, citizens of Pennsylvania, the tax man is cometh for your wallets. You can guarantee that. Madam Speaker, for these many reasons, I'll be a no-demite. I hope my colleagues join me and realize that the horrible financial situation will put this Commonwealth in. But unfortunately, I think financial sound practices are going to fail the taxpayers tonight. Thank you, Madam Speaker.
Chair thanks the gentleman. Colleagues, if I can have your attention. In the rear of the House, my favorite folks from the 153rd Legislative District are here. My sister-in-the-law, the Montgomery County Controller, Karen Sanchez, and Big Ben, Little Ben Sanchez. We're so glad to see you all here. Thank you for joining us. Always good to see you. Chair recognizes the gentleman from Philadelphia, Majority Appropriations Chair, Representative Harris.
Thank you, Madam Speaker. Madam Speaker, I'm actually going to be brief tonight because the work speaks for itself. Madam Speaker, I've stood on this floor and I've said it many times that budgets are moral documents. I've said before, Madam Speaker, that a budget isn't just about dollars and cents, but a budget, particularly our state's budget, tells you where our priorities are. And Madam Speaker, I've been in this building, in this very chamber, serving my constituents for more than a decade. And I have to tell you, Madam Speaker, that there has been many times on this floor and many budgets that have been passed where I felt like the values of this Commonwealth was not included in our budget. Madam Speaker, I'll tell you that there have been many times where we've seen budgets passed and go to the governor's desk that I felt did not show the morality of this chamber. Madam Speaker, I stand before you with a different feeling today. I stand before you because I do believe that this document that we are going to vote on tonight, it shows where our values are. I think that this budget tonight articulates to Pennsylvanians from the rural places of our Commonwealth to the suburban and urban places. It shows where our moral compass is. Madam Speaker, this budget makes one of the most historic investments in what is our most valuable resource, and that is our children. For once, Madam Speaker, this august body, this building has stood up to the call to actually fund our schools and the way that they should be funded. Now, bear with me for a second. Let me put y'all on some game real quick. In the words of the great Kendrick Lamar, who is beating another rapper right now, to the good gentleman from Allegheny County. Are you locked in, Representative? Are you locked in? Let me tell you about this budget. This budget helps us make a significant down payment on the Commonwealth Court ruling that says that how we fund our schools are unconstitutional. You know, there was a gentleman who talked about some schools where our young people can't do 1, 2, 3, 4, 5, 6, 7, 8, 2, 3, 4, 5, 6, 7, 8. 3, 4, 5, 6, 7, 8, or they can't do mathematics. But I stand here today to tell you that it is easy to blame those children, but it is hard to put up the vote of accountability that our schools have been underfunded and starved for resources for far too long. It is easy to blame the child. It is easy to blame the parent. It is easy to blame the teacher. It is easy to blame the administrators. But what is hard to do is to look at all of the votes that folks have been putting up that have not been sending the dollars and cents to our schools like they have supposed to been doing for years. It is easy to shift the blame to somebody else than it is to point the finger at oneself to see what we have not done for our children. But Madam Speaker, we all have an opportunity right now. We have a chance to do the right thing, to right the wrongs of our past. You see, my colleague, my counterpart, he mentioned Montgomery County, he mentioned other counties. He didn't mention his county, and there's a reason why. Because it ain't a lot of zeros in that county, because there's money going to that county. Why? Because those schools have been underfunded as well. So yes, this ain't just about urban Pennsylvania or suburban, but it's about rural Pennsylvania as well. And we have an opportunity to do the right thing. So let me just give you a brief reason why you should vote for this. One, you should vote for this budget for the educational spending that is in it. Two, you should vote for this budget for the educational spending that's in it. Three, you should vote for this budget for the educational spending that's in it. And four, you should vote for this budget for the educational spending that is in it. Because at the end of the day, if our children can't read or write or do math, it is not necessarily their fault. It is the failure of the body to provide the resources that they need. Our biggest requirement as a body is this budget. And for once, I can tell you that I'm not just pushing the budget or the button for this budget out of an obligation. I'm pushing this budget because I am proud to say, once and for all, that this body did the right thing by our children, by our teachers, by our parents. And here's the other thing that they won't tell you: by our taxpayers, who many can get a reduction in their taxes because we're finally doing our job. So, this ain't one of those, I could talk about $261 million for ID, for our intellectual disability community. I can talk about, the money that we're sending so that our young girls who are in school can come to school, during their time of the month, and they don't have to stay home because of poverty. We could talk about that. We could talk about the money that's going to neonatal centers and OB centers across this Commonwealth, so mamas all over this Commonwealth can deliver their babies in healthy centers. We could talk about that too, because there's a whole lot of good in this budget. So now the question is simply this: what you gonna do? Gonna stand on political rhetoric, or you gonna stand with the people? Madam Speaker, it is going to be my privilege, it is going to be my honor, and it is going to be my pleasure to push the green button for a budget that we all can be proud of, a budget that shows Pennsylvanians where our priorities are. And I urge every member in this chamber to put up a vote for a budget that is going to fund our schools, that's going to take care of our mamas, that's going to take care of our baby girls, that are going to take care of CTE, that's going to take care of our seniors, that's going to take care of those with intellectual disabilities, that's going to do a whole lot for all of Pennsylvania. Come on and let's pass this budget and send it over to the governor's desk.
Seeing that debate has concluded, this bill will be temporarily over. The chair is in receipt of extracts from the Journal of the Senate, which the clerk will now read.
Clerk of the Senate being introduced, return bill from the House of Representatives, numbered and titled as follows. House Bill 1633. With information, the Senate has passed the same with amendment in which the concurrence of the House of Representatives is requested. Clerk of the Senate being introduced to inform that the Senate has concurred in the amendments made by the House of Representatives by amending said amendments to Senate Bill numbered and entitled as follows. Senate Bill 654, ordered that the clerk present the same to the House of Representatives for its concurrence. Clerk of the Senate being introduced, return bill from the House of Representatives numbered and entitled as follows. House Bill 115. With information, the Senate has passed the same without amendment. Bills numbered and entitled as follows, having been prepared for presentation to the governor, and the same being correct, the titles were publicly read as follows. House Bill 115, Senate Bill 209, Senate Bill 559, Senate Bill 560, House Bill 1032, House Bill 1993, and House Bill 2216, whereupon the Speaker, in the presence of the House, signed the same.
Chair is about to sign the following bills, which the clerk will now read.
House Bill 115, Senate Bill 209, Senate Bill 559, Senate Bill 560, House Bill 1032, House Bill 1993, and House Bill 2216.
Chair recognizes the Majority Leader who calls up Senate Bill 1001. Chair recognizes the Majority Leader who calls up Senate Bill 700, printer's number 1816, on page 2 of Supplemental Calendar C. Will the House agree to bill agreed to? The clerk will read the title and a brief description of the bill.
This bill amends the public school code to make it easier for individuals with relevant work experience to become a career and technical educator.
This bill's been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Chair seeks speakers on Senate Bill 700 final passage at this time. The chair seeks speakers for debate on Senate Bill 700 final passage at this time. Seeing that debate is concluded, the bill is temporarily over. Chair recognizes the Majority Leader who calls up Senate Bill 1150, printer's number 1818, on page 2 of Supplemental Calendar C. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill creates the Grow Pennsylvania Scholarship Grant Program.
Will the House agree to the bill? On that question, Chair recognizes. The question is, shall the bill pass the House finally? On that question, Chair recognizes the gentleman from Bedford, Minority Chair of Education, Representative Topper.
Thank you, Madam Speaker. A common refrain in my district, that I'm sure in many of your districts, is when you speak to constituents and they bring up one of their main concerns, which is we're worried that our kids and our grandkids are not going to stay in Pennsylvania. We've all heard that, the doors we've knocked, the events that we've attended. We do have a demographics problem in Pennsylvania. We also have a workforce shortage problem in Pennsylvania. And an area that we can look at to really improve is comprehensive reform of our system of higher education. And I remember it was during Governor Shapiro's first budget address, he said that we can't continue to do things the same way and expect different results when it comes to higher education in the Commonwealth. Now, higher education, admittedly, and the reformation of that system is not as flashy as a lot of other issues that we talk about in state government. And I was reminded of that fact when, after the governor said that, there was one lone person standing up and clapping, and I looked around and realized I was by myself. But it is the number one way that we can look to address our workforce and demographic concerns in Pennsylvania. I'd like to thank Senator Martin, Senator Ahmet, Senator Argel, Senators Pittman and Ward for their work on Grow PA, an initiative that is meant to marry our workforce demands with our need to reform higher education. Just a couple highlights from this bill. This will enable us to recruit and retain students, to obtain scholarships when they enroll in high-demand degree programs, and stay in Pennsylvania, and work in Pennsylvania, and reside in Pennsylvania. And so I believe that this is a critical step as we examine our return on investment for our dollars in higher education. In basic education, we do have a constitutional obligation to ensure that our students have access to a high-quality education. In higher education, we have no requirement. So we must ensure that the dollars that we devote to it have a return on investment so that we can see it in the Commonwealth, not just today, but in years to come. And I believe that SB 1150 is a tremendous step in that direction. I would ask my colleagues for a yes vote. Thank you, Madam Speaker.
Chair thanks the gentleman. Chair recognizes the gentleman from the Lehigh. Majority Chair of Education, Representative Schweier.
Thank you, Madam Speaker. Appreciate the opportunity to address this body on this legislation, Senate Bill 1150, but also there will be two subsequent higher education bills that we will be considering later today. At least that's my anticipation. And on a very personal level, I'm one of these members, and you hear the story up here a lot. I'm not unique or special, but I'm not only a first-generation college graduate, I'm a first-generation high school graduate. My father never finished high school and instead served our country in Vietnam. And the day that I graduated from college, from Penn State, was not only one of the most important days of my life, but it was the proudest day of my dad's life. I'm an only child, and so, just that opportunity to see his son do something that he was never able to do really impacted him in a very profound way. My father lost his battle with cancer and addiction a few months after I graduated from college, but his ability to see me do something that he knew he had in him as a smart kid who just didn't have the right chances was really, truly an important moment for me as a human being and for my family. But more so, Madam Speaker, I'm also one of these members that didn't have the easiest upbringing. I lived in 9 places by the time I was 18 years old. The first time that I was able to actually have a steady home for more than a few years was the house that I live in now that I was able to buy. And I was able to purchase that house because I was able to start a career because of the pathway that higher education gave me. And one of the very real things that we don't say enough in this General Assembly, or frankly anywhere, Madam Speaker, is that there are good, smart, capable, talented kids from all walks of life in every zip code, in every community, across our Commonwealth. Senate Bill 1150 and subsequent bills on higher education are going to make it infinitely easier for those good, smart, capable, and talented kids from across our Commonwealth to achieve their goals. We all know higher education isn't for everybody, but for those students who are choosing that path, this bill and the subsequent bills are going to make it significantly easier for them. I want to thank my friend, the Minority Chair of Education, all the folks that worked incredibly hard on this over in the Senate. This has truly been a bipartisan effort, and I will encourage a yes vote on Senate Bill 1150. Thank you, ma'am.
Chair thanks the gentleman. On that question, Chair recognizes the gentleman from Lancaster, Representative Cutler.
Thank you, Madam Speaker. Madam Speaker, I'd like to echo my thanks to both the Republican and the Democratic chair on this package of bills. I know this is just the first of hopefully 3 that we will see here later this evening. And the good gentlemen from the Lehigh Valley and good gentlemen from Bedford have worked very diligently on this, them and their staff. I greatly appreciate it. I stand here in support of not just this bill, but them and their efforts. I appreciate their hard work, and I'll submit the remainder of my remarks for the record. I urge all members to support this.
Chair thanks the gentleman. Seeing that debate has concluded on final passage of Senate Bill 1150, the bill is temporarily over. Chair recognizes the Majority Leader who calls up Senate Bill 1154, printers number 1819 on page 2 of Supplemental Calendar C. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This bill establishes a performance-based funding council to develop a new performance-based funding system for Penn State, Pitt, and Temple.
This bill's been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Chair seeks speakers on debate. Seeing that debate is concluded for final passage of Senate Bill 1154, the bill is temporarily over. House is temporarily at ease. The House will come to order. For what purpose does the gentleman from Montgomery County Majority Leader Representative Bradford rise?
Madam Speaker, I rise to make a motion.
The gentleman is in order and may proceed.
Madam Speaker, I make a motion to proceed on the immediate consideration of Senate Bills 700, 1001, 1150, and 1154.
The gentleman, Representative Bradford, moves to proceed to the immediate consideration of Senate Bill 700, Senate Bill 1001, Senate Bill 1150, Senate Bill 1154. The question is, will the House proceed to the immediate consideration of said bills? All those in favor will be voting. Chair recognizes the gentleman from Lancaster, Representative Cutler.
Thank you, Madam Speaker. I apologize. I was just waiting until the motion was on the board. I want to support the gentleman's motion, given that these bills need to arrive in the Senate so that we can complete the budget process, and recognize that there's still a lot of work to be done yet this evening, and we're waiting on some bills from them. Urging members to support it.
Chair thanks the gentleman. All those in favor of proceeding will vote aye. All those opposed will vote no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the votes. On the question, the yeas are 183, the nays are 19. Two-thirds majority having voted in the affirmative, the motion passes. Chair recognizes the majority leader and calls up Senate Bill 1001, printers number 1817 on page 1 of supplemental calendar C. Will the House agree the bill is agreed to? Clerk will read the title and a brief description of the bill.
This is the general appropriation bill for fiscal year 2024 through 2025.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 122, the nays are 80. The majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will present the same information to the Senate. The House has passed the bill with amendment in which the concurrence of the Senate is requested. The chair recognizes the majority leader who calls up Senate Bill 700. Printers number 1816 on page 2, supplemental calendar C. Clerk will read the title and a brief description of the bill.
This bill amends the public school code to make it easier for individuals with relevant work experience to become a career and technical educator.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage. The yeas are 137, nays are 65. Majority required by the Constitution having voted in the affirmative, The bill passes the House finally, and the clerk will present the same to the Senate with the information that the House has passed the bill with amendment in which concurrence of the Senate is requested. Chair recognizes the Majority Leader who calls up Senate Bill 1150 for his number 1818 on page 2, supplemental calendar C. Clerk will read the title and a brief description of the bill.
This bill creates the Grow Pennsylvania Scholarship Grant Program.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 202, the nays are 0. Majority required by the Constitution having voted in the affirmative, the bill passes the House finally. Clerk will present the same to the Senate with the information that the House has passed the bill with amendment in which the concurrence of the Senate is requested. The Chair recognizes the Majority Leader who calls up Senate Bill 1154, printers number 1819 on page 2 of supplemental calendar C. Clerk will read the title and a brief description of the bill.
This bill establishes a performance-based funding council to develop a new performance-based funding system for Penn State, Pitt, and Temple.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the final passage of the bill. The yeas are 188, the nays are 14. The majority required by the Constitution having voted in the affirmative, bill passes the House finally, and the clerk will present the same information to the Senate that the House has passed the bill with amendment in which the concurrence of the Senate is requested. Chair recognizes Representative Schlossberg for a committee announcement.
Thank you, Madam Speaker. There will be a brief Rules Committee meeting in the House Majority Caucus room right now.
The House will be at ease for the immediate meeting of the Rules Committee meeting in the Majority Caucus room.
House will come to order. Chair recognizes Representative Bradford, Chair of the Committee on Rules, who reports the following bills. House Bill 1540, re-reported as committed. Will the House agree to the report? Agreed to. House Bill 1633, re-reported as committed. Will the House agree to the report? Agreed to. Senate Bill 654, re-reported as committed. Will the House agree to the report? Agreed to. Chair recognizes the Majority Leader who calls up House Bill 1540, printers number 3496 on page 1 of Supplemental Calendar D for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? Chair recognizes Representative Representative Briggs.
Thank you, Mr. Speaker. This is Ag Excellence. The Senate made an amendment to 1540 to reduce the commission members from 15 to 14 and to streamline the process. Encourage all the members to vote in the affirmative. I am going to be submitting the rest of the comments to the record. Thank you.
Chair thanks, gentlemen. Agreeable to the provisions of the Constitution, yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 138, the nays 64. The majority required by the Constitution having voted in the affirmative, the amendments are concurred in, and the clerk will inform the Senate accordingly. The chair recognizes the majority leader who calls up House Bill 1633, printers number 3504 on page 1 of Supplemental Calendar D for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? The chair recognizes Representative Frankel for a brief description of the Senate amendments.
Thank you, Mr. Speaker. The Senate made the following changes to the bill: to allow non-competes throughout the entire state up to 1 year, allow non-competes when they are related to the sale of a business, changing the patient notification requirement to apply to patients of 2 years or more. They changed the providers that impacted to doctors, certified registered nurse practitioners, nurse anesthetists, and physician assistants. In addition, the bill now requires a Pennsylvania Healthcare Cost Containment Council study of the impacts of restrictive covenants. I've spent years, along with many others in this chamber, to get non-compete clauses completely out of our health workers' contracts. They hurt patients, they interfere with the careers of our medical professionals, and they scare away top talent from our Commonwealth. This bill does not go as far as I intended. Restrictive covenants will still be allowed, and our expert physicians and providers can be prohibited from serving their communities for an entire year of new babies, cancer treatments, emergency rescue, COVID scares, and more. That's expertise and care that we can't afford to lose, not for a year, not for a month. But at least we finally have a limit on these covenants, and we can start to get a sense of their impact. I'd hope to see a geographic limitation on these covenants, in addition to the time limitation. When my co-chair of the Health Committee amended our legislation for rural counties, she made it clear that non-compete applied only to primary health care facilities, not an entire network of hospitals. I consider this bill as a first step. I'm grateful for all the work that has been done by my colleagues to make this progress. House Bill 1633 sends a signal that this legislative body won't tolerate covenants that trap doctors forever. And language in the preamble, which is very important, makes clear to the courts who are reviewing these covenants that the General Assembly considers restrictive covenants to be anti-competitive and harmful to patients. It's not perfect, but it's a start. I ask you to vote for this bill today and to continue to work with me on this issue to protect patients and providers even further. Thank you, Mr. Speaker.
Chair thanks the gentleman and recognizes the gentleman from Adams, Representative Ecker.
Thank you, Mr. Speaker. Mr. Speaker, I want to thank the good gentleman from Allegheny County for this bill. This is something that we worked together on before this session and last session, and we had these issues that constituents bring to us. And that's why I got an interest in this bill, because in my office, I met with a patient and her doctor who was a victim of a non-compete where she couldn't find her doctor after he was terminated or his contract was not renewed. This bill is personal. This is one of those issues that we all have had where a constituent shows up and brings an issue to our attention. I learned a lot about it and realized this bill is not about physicians, it's about patients. This bill is about patients and access to health care, and that's why I will be supporting this bill to help the constituents that met with me to bring this issue to my attention, and I appreciate the good gentleman from Allegheny County. Thank you, Mr. Speaker.
Chair thanks the gentleman. Agreeable to the provisions of the Constitution, the ayes and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 155, the nays 46. The majority required by the Constitution having voted in the affirmative, the amendments are concurred in, and the clerk will inform the Senate accordingly. Chair recognizes the Majority Caucus Chairman for an announcement.
Thank you, Mr. Speaker. Mr. Speaker, there will be a Rules Committee meeting at 6:50 in the House Majority Caucus Room. Rules Committee, 6:50.
The chair thanks the gentleman. This House will be at ease.
The House will come to order. Chair recognizes the gentleman from Lackawanna County for a committee announcement. Representative Mullins.
Thank you, Madam Speaker. The Appropriations Committee will meet immediately in the Majority Caucus Room. The Appropriations Committee will be meeting immediately in the Majority Caucus Room. Thank you, Madam Speaker.
Chair thanks the gentleman. The House will be at ease for the immediate meeting of the Appropriations Committee meeting in the Majority Caucus Room. The House will be at ease for the immediate meeting of the Appropriations Committee in the Majority Caucus Room. The House will come to order. The chair is in receipt of extracts from the Journal of the Senate, which the clerk will now read.
Clerk of the Senate being introduced, returned bill from the House of Representatives, numbered and titled as follows. House Bill 897 and House Bill 2310. With information, the Senate has passed the same with amendment in which concurrence of the House of Representatives is requested.
Chair is about to sign the following bills, which the clerk will now read. Chair recognizes Representative Harris, Chair of the Committee on Appropriations, who reports the following bill. Senate Bill 831, re-reported as committed. Will the House agree to the bill? It's agreed to. Chair recognizes Representative Bradford, Chair of the Committee on Rules, who reports the following bills. House Bill 897, re-reported as committed. Will the House agree to the report? It's agreed to. House Bill 2310, re-reported as committed. Will the House agree to the report? It's agreed to. The chair recognizes the Majority Leader, who calls up Senate Bill 831, printer's number 1793 on page 1. Supplemental Calendar F. Will the House agree the bill is agreed to? The clerk will read the title and a brief description of the bill.
This bill establishes regulatory authority and framework for carbon capture and sequestration in our Commonwealth.
This bill has been considered on 3 different days and agreed to. The question is, shall the bill pass the House finally? On that question, Chair recognizes the gentleman from Columbia, Representative Ledbetter.
Thank you, Madam Speaker. Madam Speaker, tonight I rise to oppose Senate Bill 831. Senate Bill 831 is a handout for carbon capture, leaving everyday Pennsylvanians out in the cold. This carbon capture legislation set forth is a roadmap for massive subsidies worth billions of dollars. In 2023, a report from the Intergovernmental Panel on Climate Change, carbon capture was rated as one of the least effective and most expensive means of reducing greenhouse gas emissions, ranking far below options such as wind, solar, geothermal, and nuclear power. While hardworking Pennsylvanians like those in my district are struggling to make ends meet due to the highest inflation in 45 years, this carbon capture legislation is laying the groundwork to give our tax dollars for a technology that is experimental at best. While Pennsylvanians can't afford groceries, can't afford fuel at the gas pump, and can't afford their electricity bills, the federal and state government plans to give our tax dollars out in multi-billion-dollar handouts, all in the name of a climate change agenda. Madam Speaker, I have a better idea. Let's vote this carbon capture legislation down and vote for tax cuts to give hardworking Pennsylvanians some of their tax dollars back. Let's end this welfare climate change scheme, which is being pursued in this carbon capture legislation, and get to work on being good stewards of Pennsylvanians' tax dollars. Voting for technology that is unproven is voting for technology for flux capacitors or any other theoretical technology yet to be proven today. Vote no on Senate Bill 831 and stand up for hardworking Pennsylvanians across our Commonwealth. Thank you, Madam Speaker.
Chair thanks the gentleman on that question. Chair recognizes the gentleman for York, Representative Diorsi.
Thanks, Madam Speaker. I also rise in opposition to Senate Bill 831 because it's an infringement on private property rights. This carbon capture legislation establishes a form of subsurface eminent domain of property owners' pore space, forcing property owners to allow CO2 storage under their property. Carbon capture is not an exact science, meaning the CO2 will go wherever it goes once it's pumped into the ground. Under this legislation, CO2 will be pumped into the ground and fill the pore spaces and voids in the underground strata. When this CO2 is pumped into the ground, there's no way of knowing exactly where it may end up. Under this legislation, no agreements are required with property owners before a company acquires permits from the Department of Environmental Protection to store carbon under their land. If property is owned by multiple owners, the Environmental Hearing Board can require that carbon capture be done on that shared property, meaning you don't need unanimous consent from property owners who have shared interests in that property. To add insult to injury, the board may order payment of attorney fees and costs of the administrative hearing on non-consenting property owners. Under this carbon capture legislation, it would allow for entry onto private property for seismic testing without the owner's permission. So make no mistake, Senate Bill 831 is an extreme takeover of Pennsylvania private property rights. It is giving the Green New Deal extremists control over what happens on your property. This legislation is nothing short of a land grab, and I ask my colleagues to oppose it. Thanks, Madam Speaker.
Chair thanks the gentleman. Chair recognizes the gentlelady from Chester County, Representative Otten.
Madam Speaker, I rise to oppose Senate Bill 831. As some speakers would like to have you believe, carbon capture and forcing residents to have experimental industry practices imposed upon their properties is not a good environmental policy, and it's really not good public policy. A former senator from Chester County, when I first thought about running for office, brought me in to meet with him to talk about what working here in this building was going to be like. And he said to me, Danielle, every day I pray on my way into that Capitol building to not allow the cynicism of this place to change you and to stop you from doing what's right. For the last 6 years in my community, we have lived with the consequences of bad policies like this one that take the rights of private property owners and give them to corporations. In Senate Bill 831, if you have a group of neighbors who are being considered for carbon sequestration on their land, in many cases, like many of us, like many of our families, like our constituents, your land is everything you have in the world. It's everything you've worked for, and in some cases, it's everything that your family has worked for generationally to provide and pass on. The government is giving private corporations the ability to take your land without your consent if they can get 70% of your neighbors to agree. Not only that, they're imposing an experimental industrial practice on your land, and the liability language of this legislation would also weaken your ability for recourse if they were to impose damage upon your land during these experimental procedures. And as a Pennsylvania resident who unfortunately lived through the experimental procedure of horizontal directional drilling for pipelines through 355 miles of untested geology in Pennsylvania, I watched 36 of my neighbors lose their private well water on 4th of July weekend in 2017. A brand new neighbor who had just bought her first home posted on our neighborhood group that she had brown water coming out of her faucet. 36 other families that same weekend experienced the same thing. I have a constituent still today. Pipeline construction has been done since 2021 in my district. I have a constituent still today that we speak with on a weekly basis who lives across the street from Marsh Creek State Park, where 20,000 gallons of drilling mud was poured into the lake and lost underground. Their well was ruined. They had to spend $30,000 for a new well, and they're still fighting for recourse to get the company to pay for their water. In Dimock, Pennsylvania, corporate polluters poisoned the water of countless families in an entire town. Movies have been made about it. 10 years later, those residents are still without safe and clean drinking water in their homes to bathe, cook, and drink, while that company that poisoned their water has been permitted by the DEP, who we're going to give authority over carbon capture, has allowed them to continue fracking in their communities. They still don't have their water. You don't have to oppose carbon capture to oppose the taking of private property rights and the public policy practice of privatizing profits for corporations while socializing the risks and the cost for the residents of Pennsylvania. You don't have to be for or against climate solutions to be against privatizing profits for corporations and socializing the costs and risks to your constituents. Many people like to talk about how this is only Western Pennsylvania, But let me be very clear. One only needs to look at the Team PA plan for hydrogen and carbon capture to see the maps of exactly where the infrastructure to support this industry are going to go. And they will be in Western Pennsylvania, they will be in Central Pennsylvania, and they will be in Southeastern Pennsylvania. So if you think your constituents will go untouched, you may be mistaken. And they will be coming to you, trust me, to ask questions when those land agents are coming to them and telling them that they don't have a choice. I ask for everyone to join me in voting no on Senate Bill 831.
Chair thanks the gentlelady. On that question, Chair recognizes the gentleman from Perry, Representative Stanball.
Thank you, Madam Speaker. Madam Speaker, I rise in opposition to Senate Bill 831 as I believe it is at best premature. I also believe we already have an instant remedy to climate change here in our state, and that's agriculture. Agriculture is the #1 industry in Pennsylvania, certainly the #1 industry in the 86th State House District, and I believe it can lead the way in CO2 emission reductions all across the board. We don't really need this kind of carbon legislation. We just need to plant more trees. We also need our farmers to be encouraged to plant more worm season grasses like switchgrass and bluestem, which have deep roots and soak up a lot of carbon dioxide. We also don't need this legislation because we just need to encourage our farmers to continue using no-till conservation practices that keep a lot of the carbon dioxide down in the soil. I would also argue, Madam Speaker, that the goal of carbon capture and storage, essentially the premise is you pull the carbon out of the ground from a coal mine or from an oil well, and eventually when that coal mine or oil well is depleted, you pump that carbon dioxide gas back down into that reservoir, and hopefully it's entombed forever. But I say hopefully, because we all know that eventually somebody could be pumping 50 years worth of carbon dioxide gas down into a hole in the ground. The new Madrid fault line out in the Midwest erupts, and suddenly that reservoir cracks, and you have decades of carbon dioxide escape. Who is liable for that? We've kept our nuclear industry alive in this country since the 1950s because the federal government put liability protection in for nuclear plant owners through the Price-Anderson Act. And unless the federal government steps in and puts liability protection on the operators of any carbon capture and storage operation, Madam Speaker, that liability risk is very real, and quite frankly, I think until we can mitigate it, it's too dangerous for Pennsylvania at this time. Thank you.
Chair thanks the gentleman. Chair recognizes the gentlelady from York, Representative Kiefer.
Thank you, Madam Speaker. I rise to oppose Senate Bill 831. Senate Bill 831 removes liability from corporations conducting carbon capture in the Commonwealth. This carbon capture legislation will leave many questions as to who is responsible for any devastating consequences of carbon capture technology. If a Pennsylvania family's water is contaminated by CO2 being pumped into the ground, who's responsible? Under the carbon capture legislation, one thing is very clear. It won't be the multi-billion-dollar corporation conducting the carbon capture experimental technology. What if an earthquake is caused by the carbon capture technology and your home is destroyed? Who's responsible? Under the carbon capture legislation, it's clear. It won't be the multi-billion-dollar corporation conducting the carbon capture technology. So it leads me to ponder, why is this legislation written to protect the multi-billion-dollar corporations proposing to do this carbon capture technology in the Commonwealth? If carbon capture is so safe and proven, then why is this legislation written to protect the corporations conducting the carbon capture work? It is because carbon capture is not a proven science. There are a lot of unknowns that come with it, and no one wants to be held liable for any of the devastating consequences of this experimental work. While carbon capture legislation allows the multi-billion-dollar corporations to mitigate their risk, Pennsylvanians will be left trying to figure out what to do when their water is contaminated or an earthquake has destroyed their home and insurance won't cover it due to experimental carbon capture work done beneath the surface. Let's protect Pennsylvanians and their property, and let's vote down Senate Bill 831. Thank you, Madam Speaker.
Chair thanks the gentlelady. On that question, Chair recognizes the gentlelady from Fayette, Representative Krupa.
Thank you, Madam Speaker. I rise today to express my strong opposition to Senate Bill 831. This bill is fundamentally flawed, both in the environmental approach and in its disregard for the constitutional rights of Pennsylvania landowners. First, let us consider the environmental implications of carbon capture storage. The idea of capturing carbon dioxide emissions from industrial sources and storing them underground may sound promising at first glance. However, the long-term storage of carbon dioxide underground carries considerable risks. There's the potential of leakage, which could lead to the release of stored carbon dioxide back into the atmosphere, negating any short-term benefits. Such leaks could also contaminate groundwater and have extremely adverse effects on air quality, posing serious health risks to nearby communities. There are also very serious constitutional concerns raised by this bill. Under the proposed legislation, landowners could be forced to give up their subsurface rights for carbon capture without due process of law. This is a clear violation of the Fifth Amendment of the United States Constitution, which guarantees that no person shall be deprived of life, liberty, or property without due process of law. The subsurface rights of landowners are a critical component of their property rights. Requiring them to relinquish these rights without adequate compensation and without the proper legal procedures is not only unjust, it's unconstitutional. The government cannot simply override private property rights for the sake of expediency or economic gain. Furthermore, this bill sets a dangerous precedent. If we allow the government to infringe upon subsurface rights today, what other property rights are they going to come in and take tomorrow? We must stand firm in protecting the rights of our constituents and ensuring that any measures taken to address environmental concerns do not come at the expense of fundamental constitutional protections. The approach outlined in this carbon capture bill was misguided. It's environmentally unsound, and it violates the constitutional rights of Pennsylvania landowners. I urge my colleagues to consider these points and vote against the bill. My constituents in Fayette County already have to battle against environmental injustices, such as injection wells for toxic frack water, and they're currently battling against industrial solar invading our farms and our residential areas. We refuse to accept governmental attempts to force experimental carbon capture on us as well. I urge a no vote. I plead for a no vote. Thank you.
Chair thanks the gentlelady. On that question, Chair recognizes the gentleman from Delaware County, Majority Chair of Environmental Resources and Energy, Representative Vitale.
Thank you, Madam Speaker. I rise in opposition to Senate Bill 831. First, I'd like to compliment the chairman of the Consumer Protection Committee. I think he did a nice job in improving the bill. Regrettably, though, I think that the bill really is the wrong direction for Pennsylvania right now. Carbon capture technology, it's enormously expensive, and it's never been proven to be commercially feasible. I'm not really satisfied with the direction that we are going with hydrogen production and intended carbon capture. Madam Speaker, I think one of the problems is this is not being viewed by those in Pennsylvania who have the power as a tool to address climate change. Rather, it's being viewed as a means to either create jobs or perpetuate the fossil fuel industry. This is enormously expensive. And if you really want to address climate change, there are much more effective measures that give you more bang for the climate buck. Expanding renewables, energy conservation. These are tried and true methods of addressing climate change as opposed to carbon capture, which is enormously expensive and has been really an unproven technology. You know, there's some technical problems with the bill. As mentioned, liability here ultimately will fall with the taxpayers of Pennsylvania. Industry will profit by carbon capture, but after a certain period of time, liability will fall to the state. And that's just wrong. As also has been mentioned, it forces unwilling landowners to use their pore space and participate. And as the lady from Chester County has indicated, it will require an enormous expansion of pipeline to carry the sequestered carbon from where it is extracted to where it is put in the ground. This will also pipeline to distribute the produced hydrogen. Again, this will cause massive disruption to property owners. Also, the disposal of CO2 creates an alternative waste stream that we have to deal with. I may feel differently about this issue in the future, but right now it is unproven technology. We failed to demonstrate it's commercially feasible. There are more cost-effective ways to address the problem. You're putting Pennsylvania taxpayers at risk with the liabilities associated with this. You are forcing landowners who do not wish to participate to participate. You are causing the imposition of pipelines going through people's properties. For many reasons, I do not think this is the right solution right now. I think it's time that we vote no on this bill now and consider it perhaps at a later time. Thank you.
Chair thanks the gentleman. Chair recognizes the minority chair for Environmental Resources and Energy, the gentleman from McCann, Representative Caucus.
Thank you, Madam Speaker. Madam Speaker, it's not often that I agree with the majority chair of the Environmental Resources and Energy Committee. I think there's a few times we've agreed this session, and while we might be on opposite sides on this bill for even different reasons, I am in fact opposed to Senate Bill 831. I have a number of concerns with the bill. Much has been said tonight about this bill. There are legitimate concerns, private property rights issues, giving broad authority to DEP and the EQB to write rules and regulations, giving complete authority to DEP to set fees, liability concerns. Madam Speaker, I don't think there's a bigger supporter in this room of energy development than me, but I'm very concerned about this bill and feel that it's not ready for prime time. I think this bill needs more work. I think the bill should have been considered in the Environmental Resources and Energy Committee, first and foremost, and with the concerns that I've expressed and those concerns by others, I would urge a negative vote. Thank you, Madam Speaker.
Chair thanks the gentleman. Chair seeks final speakers Before going to the majority chair, whose committee the chair signed it to. Chair recognizes the gentleman from Beaver, Representative Matsey.
Thank you, Madam Speaker. Madam Speaker, I rise today in support of Senate Bill 831. And I want to make sure that the members understand what this bill is and what it isn't. But to do that, it's important to understand why this legislation is necessary. Last fall, the Biden administration announced plans to invest $1.6 billion into building 2 hydrogen hubs partially located in Pennsylvania, one in the Southwest and one in the Southeast. With that action, the die was cast. There will be 2 hubs in Pennsylvania. That is a fact. They are coming. And with them comes the need for carbon capture and storage known as CCS. So the question becomes how and by whom will that be regulated? When carbon dioxide is injected into the pore space, that is considered a well. And that well, as determined by the EPA, is called a Class 6 well. Currently, the process and standards for those wells is overseen and controlled by the EPA. This is called primacy. But the states have the opportunity to regulate CCS through their own regulatory agencies if they meet certain criteria set by the EPA. The states have to apply for what is called Class 6 primacy. And the necessary component is obtaining primacy is to have a regulatory framework in place. Currently, North Dakota, Wyoming, and Louisiana are the only states to receive primacy. Arizona, Texas, and West Virginia are the other states that are in or have begun the process of applying for primacy. And here we are today. The main goal of Senate Bill 831 is to gain that primacy, or in plain English, the ability to regulate CCS in our Commonwealth. In order to do that, the legislation addresses landowner liability, imposes a more stringent utilization requiring 75%, while providing a mechanism to adjudicate land disputes, adds an environmental justice provision required by the EPA, prohibits surface area use, protects public and conserved lands, tests and monitors for seismic activity, and gives DEP the financial tools from fees on the storage operators, not dollars from the taxpayers, to put in place and maintain the regulatory authority and flexibility it needs to see that CCS is done as safely as possible, both in the immediate and into the future. That, Madam Speaker, is what Senate Bill 831 does. Now, what it does not do, it does not cite CCS areas. In fact, the pore space of Pennsylvania can only store carbon dioxide in the western half of the state. No carbon dioxide will be stored in the southeast or the northeast. It does not cite or regulate pipelines. It does not set regulations for hydrogen production or distribution. And it does not enable, I repeat, it does not enable CCS. CCS will happen in Pennsylvania, regardless of if Senate Bill 831 is enacted or not. The only controllable is whether we determine how it will be done. This bill is the result of well over a year of negotiation between the Senate, the House, and key stakeholders. But don't just take it from me. Listen to some of the stakeholders, environmental, industry, and labor who've weighed in. EDF, PEC, the Nature Conservancy, and Clean Air Task Force are supportive. The building trades, the IBEW, LIUNA, and a long list of other labor organizations. Equally as important, Sierra Club, Penn Environment, Penn Future, and the conservation voters are neutral. Senate Bill 831 is a pragmatic approach to deal with what is coming on our own terms as a Commonwealth and not to be beholden to the federal government. If it's happening in our state, on our land, we should be the ones deciding on how it should be done. Senate Bill 831 gives us that purview. I ask for a yes vote. Thank you, Madam Speaker.
Chair thanks the chairman. Agreeable to the provisions of the Constitution, the ayes and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 127, the nays are 75. The majority required by the Constitution having voted in the affirmative, the bill passes the House finally, and the clerk will present the same to the Senate. With the information that the House has passed the bill with amendment in which the concurrence of the Senate is requested. The chair recognizes the majority leader who calls up Senate Bill 654, printer's number 1815, page 1, supplemental calendar D, for concurrence in Senate amendments to House amendments. Question is, will the House concur in the amendments inserted by the Senate to the House amendments? The chair recognizes Representative Samuelson for a brief description of the Senate amendments.
Thank you, Madam Speaker. Senate Bill 654 on concurrence is the tax code, which is before us this evening. This bill includes 18 changes to the tax laws of Pennsylvania, not one of which represents a tax increase. There are several provisions affecting businesses in Pennsylvania, affecting individual taxpayers. A complete list of all 18 changes is in the bill analysis before you. I would just like to highlight a couple. There's a transfer from the general fund to the Clean Streams Fund of $50 million. There is a provision that payments received related to the train derailment near East Palestine are not considered taxable in Pennsylvania. There's also a new provision to allow individuals with student loans to deduct the interest they pay on their personal income tax. This is allowed on your federal tax return currently. Going forward, students in Pennsylvania who are paying on their student loans could deduct their student loan interest from their personal income tax in Pennsylvania. There's also a provision that allows businesses that make contributions to 529 plans for college savings could get a tax credit, and also businesses that contribute to child care programs for their employees could also get a tax credit. This bill also makes sure that growers and processors and dispensaries involved in medical cannabis can claim the same tax deductions that other businesses in Pennsylvania can claim, the same necessary business expenses. This also includes an expansion of the net operating loss provisions in Pennsylvania applying to businesses. Currently, businesses can use losses from the last 20 years to offset 40% of their income. This bill would ramp that up to 50% in 2025, 60% in 2026, 70% in 2027, and up to 80% in 2028. This bill also expands affordable housing funding by making sure that the FAIR program goes from the current level of about $60 million up to $100 million over the next 4 years. There's also an expansion of the coal refuse and reclamation tax credit by about $35 million. And also, this bill would increase the historic preservation tax credit. We've had it since 2012. It was last expanded in 2018, and this would take it from $5 million to $20 million to allow additional funding for historic preservation projects in Pennsylvania. Finally, there's an increase in the Rural Investment and Jobs Tax Credit. There are a total of 18 changes, as I said, which are outlined in your bill analysis. I encourage a yes vote on the tax code, Senate Bill 654.
Chair thanks the gentleman from the Northampton, the Majority Chair of Finance, for his brief description of the Senate amendments. Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the concurrence to the Senate amendments. The yeas are 129, the nays are 73. Majority required by the Constitution having voted in the affirmative, the amendments are concurred in, and the clerk will inform the Senate accordingly. The chair recognizes the Majority Leader, who calls up House Bill 897, printer's number 3505 on page 1 of Supplemental Calendar E for concurrence in Senate amendments. The question is, will the House concur in the amendments inserted by the Senate? The chair recognizes the gentlelady from Allegheny County, Representative Kincaid, for a brief description of the Senate amendments.
Thank you, Madam Speaker. Madam Speaker, I ask my colleagues for an affirmative vote to concur in the amendments from the Senate. In addition to the underlying bill that provides for universal articulation between our community colleges and our PASHE system, the Senate amendments also provide for the reverse, where there is universal articulation from PASHE schools to our community colleges. It provides for transparency and accountability for our students when it comes to the tuition and fees that they are required to pay, provides financial aid counseling for those students. It establishes the Dual Credit Innovation Grant Program within the Department of Education and provides funding to public institutions of higher education to expand the current dual enrollment offerings. It also establishes the State Board of Higher Education within the Department of Education, and the board is responsible for developing a higher education strategic plan. So again, I ask my colleagues for an affirmative vote on these amendments. Thank you.
Chair thanks the gentlelady. Chair seeks additional speakers. Seeing there's no further debate, the bill will temporarily be over. The chair recognizes the Majority Leader, who calls up House Bill 2310, printer's number 3506 on page 1, Supplemental Calendar E. The question is, will the House concur in the amendments inserted by the Senate? The chair recognizes the gentleman from Center County, Representative Takak, for a brief description of the Senate amendments.
Thank you, Madam Speaker. House Bill 2310 is the Agricultural Innovation Fund bill, and it was amended in the Senate to be the vehicle for fiscal code adoption for the upcoming budget, and I would ask my colleagues for an affirmative vote.
Chair thanks the gentleman. Chair recognizes the gentlelady from Fayette, Representative Krupa.
Madam Speaker, I rise in opposition to House Bill 2310, which is the fiscal code package setting forth extremely important funding details on everything from the Department of Human Services to the Department of Health to the Department of Education. The bill is 138 pages and was not available in its current form to the public, to key stakeholders, to myself as a representative until just a few short hours ago. I cannot, in good faith, vote in the affirmative on such a critical piece of legislation without having a reasonable amount of time to review the language and seek input from experts, the public, stakeholders as appropriate. It's absolutely absurd that we are being asked to make a decision on whether to support or oppose this bill under the circumstances. Frankly, it seems like just another example of the shenanigans that happened during budget season in Harrisburg. Madam Speaker, I urge a no vote.
Chair thanks the gentlelady. Chair seeks additional speakers before closing debate. Seeing no other members seeking recognition. For what purpose does the gentleman from Montgomery County rise? Representative Bradford.
Madam Speaker, I rise to make a motion.
The gentleman is in order and may proceed.
Madam Speaker, I make a motion to proceed on the immediate consideration of House Bill 2310 and House Bill 897.
The gentleman, Representative Bradford, moves for the immediate consideration of House Bill 2310 and House Bill 897. The question is, will the House proceed to the immediate consideration of House Bill 2310 and House Bill 897? On that question, Chair recognizes the gentleman from Lancaster.
Thank you,
Representative
Madam
Cutler.
Speaker. Madam Speaker, I rise in support of the good gentleman's motion, understanding that these are some of the final couple budget bills that need accomplished. I move that we, since debate has concluded, I support the motion and ask the members to do so as well.
Chair thanks the gentleman. Those in favor of proceeding will vote aye. Those opposed, no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the question. The yeas are 173, the nays are 29. A majority having voted in the affirmative, the motion passes. Question recurs, will the House concur in the amendments inserted in the Senate on House Bill 2310? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 125, the nays are 77. The majority required by the Constitution having voted in the affirmative, the amendments are concurred in. The clerk will inform the Senate accordingly. The chair recognizes the majority leader who calls up House Bill 897, printer's number 3505, page 1, supplemental calendar E. For concurrence in Senate amendments, the question recurs, will the House concur in the amendments inserted by the Senate? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 187, the nays are 15. The majority required by the Constitution having voted in the affirmative, the amendments are concurred in, and the clerk will inform the Senate accordingly. Chair recognizes the majority leader who calls up House Bill 613, printer's number 3479 on page 4 of today's House calendar for concurrence in the Senate amendments. For what purpose does the gentleman from Allegheny County rise? Representative Abney. The gentleman is in order and may proceed.
Madam Speaker, I rise to make a parliamentary inquiry.
Gentleman is in order and may proceed.
Madam Speaker, I request a ruling of the chair concerning a potential conflict I may have under House Rule 65 and by extension Article 3, Section 13 of the Pennsylvania Constitution. House Bill 613 provides funding for state-aided universities, including the University of Pittsburgh. I serve as a Commonwealth trustee on the University of Pittsburgh's board. I would like to confirm my eligibility to participate in this vote.
Chair finds that the gentleman is a member of a class and eligible to participate in the vote. Chair thanks the gentleman. Question is, will the House concur in the amendments inserted by the Senate? The chair recognizes the gentleman from Philadelphia, Representative Harris, for a brief description of the Senate amendments.
Madam Speaker, this is the non-preferred package. Thank you, Madam Speaker.
Chair thanks the gentleman. Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the concurrence to the Senate amendments, the yeas are 145. The nays are 57. The majority required by the Constitution having voted in the affirmative, the amendments are concurred in, and the clerk will inform the Senate accordingly. Members, if I can have your attention. The chair encourages the members at this time on this evening to clear out your desks, as maintenance will occur over the summer months. Chair would like to wish the gentleman from Luzerne County, Representative Coffer, a very happy birthday on this day. Chair recognizes the gentleman from Washington, Representative O'Neill. For what purpose do you rise?
To correct the record, Madam Speaker.
The gentleman is in order and may proceed.
Madam Speaker, on Senate Bill 831, Representative Craig Stats was voted in affirmative. He wants to be recorded as a negative. For House Bill 1633, Representative Heffley was recorded in affirmative. He wants to be recorded in a negative. And Representative Zimmerman's vote was not recorded, and he wants to be recorded as a negative.
Chair thanks the gentleman. The information will be spread across the record. The chair wishes every member a happy, a healthy, a safe, and blessed summer. Chair referred the following bills, which the clerk will now read.
Referrals July 11, 2024. Senate Bill 1118, Judiciary. House Bill 2497 to Local Government.
Chair is in receipt of extracts from the Journal of the Senate, which the clerk will now read.
Bills numbered and titles as follows, having been prepared for presentation to the governor, and the same being correct, the titles were publicly read as follows. House Bill 613, House Bill 897, House Bill 1540, House Bill 1633, and House Bill 2310, whereupon the Speaker, there's one more, and Senate Bill 654, whereupon the Speaker, in the presence of the House, signed the same.
Chair is about to sign the following bills, which the clerk will now read.
House Bill 613, House Bill 897, House Bill 1540, House Bill 1633, House Bill 2310, and Senate Bill 654.
The House will come to order. Members, please take your seats. The chair is about to recognize Representative Kinsey. Pursuant to Rule 17, who will be making remarks regarding the passing of former Philadelphia City Council member Donna Reed Miller.
Thank you, Madam Speaker. Madam Speaker, the Honorable Donna Ann Reed Miller was born on September 29, 1946, and passed away on June 27, 2024. A beloved mother, grandmother, wife, sister, friend, mentor, and community stalwart, Donna's work will forever be memorialized throughout the city of Philadelphia. Serving as a dedicated member of Philadelphia City Council 8th Councilmatic District from 1996 to 2012, Donna's unwavering commitment to her community and to our city will continue to be felt in every aspect of the work she has championed. Councilwoman Donna Reed Miller was a champion for economic development, a champion for affordable housing, a champion for public safety, a champion fighting for the rights of returning citizens, and a champion fighting for women's rights. She was laser focused on the health, safety, and welfare of others. A Germantown native, Donna's deep connection to our community began in her early childhood. Madam Speaker, she grew up in the midst of a city facing many challenges. It was there that Councilwoman Donna Reed Miller developed a profound passion for public service, which led her to furthering her educational studies at Temple University. Her education, along with her compassion towards community activism, laid the groundwork for her impactful political career. Donna served as the Democratic Ward Leader of the 59th Ward in the Northwest section of Philadelphia, a ward which encompassed the 198th Legislative District, the 200th Legislative District, and the 201st Legislative District, respectively. Her commitment to building a better community led her to playing a key role in the early development of political careers of members who served in this very chamber. Members like Sherelle Parker, who now serves as the mayor of the city of Philadelphia. Members like Dwight Evans, who now serves as United States Representative of the 3rd Congressional District. The career of the late Honorable John Myers, State Representative of the 201st Legislative District from 1995 to 2012. The career of the late Honorable David P. Richardson, Jr., State Representative of the 201st Legislative District from 1973 to 1995, and of course, my very own career as State Representative of the 201st Legislative District. A passionate advocate for youth empowerment, Donna consistently encouraged and created opportunities for young people to step into leadership roles, challenging them to make a difference, challenging them to make our communities better. Even after her retirement from City Council, Donna's dedication to her community continued. She continued to serve on various boards and local community organizations. Madam Speaker, Councilwoman Donna Reed Miller's legacy is strong and will forever remain in the hearts and minds of those of us who have been impacted by her work. Thank you, Madam Speaker.
Chair thanks the gentleman, and Chair joins in the Majority Chair of Human Services' sympathy to the family of the late Philadelphia City Council member Donna Reed Miller. Chair recognizes the gentleman from Washington County.
Thank you, Madam Speaker. I rise to correct the record.
The gentleman is in order and may proceed.
On House Bill 613, Representative Kuzma was recorded in the negative and wants to be recorded in the affirmative.
The information will be spread across the record. For the information of the members, there will be no further votes. However, the desk will remain open to accept bills from the Senate. The House will be at ease.